Welcome back, cat lovers. If you're watching this, you've already completed the ultimate cat care masterclass. You have the fundamentals. You understand the basics. But now we're going deeper. This is the advanced masterclass. This isn't for beginners. This is for cat parents who want true expertise. We're going to explore topics that most cat owners never even think about. Advanced training techniques, complex health conditions, the cutting edge of feline behavioral science, the kind of knowledge that separates casual cat owners from true cat experts. So if you're ready to take your cat care to the next level, you're in exactly the right place. And hey, if you haven't watched Everything You Need to Know About Cats, 3.5-hour deep dive, yet I'd recommend starting there. This builds on that foundation. But if you're ready for the advanced stuff, let's dive in. Section 1. Advanced Cat Psychology and Cognition. In Everything You Need to Know About Cats, 3.5-hour deep dive, we talked about how cats see you, how they think, and how they bond. But now we're going to go much deeper into the actual science of feline cognition. How do cats actually think? What's happening in their brains? And what does cutting-edge research tell us about their mental capabilities? Let's start with memory, because this is where things get really fascinating. Cats have what researchers call episodic-like memory. This is the ability to remember specific events and experiences, complete with context about when and where they happened. For a long time, scientists thought only humans had this. Then they discovered it in some primates. And now we know cats have it too. Here's what this means in practice. Your cat doesn't just remember that you feed them. They remember the specific time you forgot to feed them and had to scramble to fill their bowl while they yowled at you. They remember the day you came home late and they were alone longer than usual. They remember the time the vet gave them that shot and exactly what the vet looked like. Research from Kyoto University showed that cats can remember specific events for at least 10 minutes with perfect clarity. And important events, especially ones with strong emotional content, can last for years or even their entire lives. That trip to the vet when they were a kitten, still there. The day you adopted them, encoded permanently. But here's where it gets even more interesting. Cats also have excellent spatial memory. They create detailed mental maps of their territory. In studies, cats have demonstrated the ability to remember the location of hidden objects even after delays. They know exactly where that toy rolled under the couch 3 days ago. They remember which cabinet the treats are in, even if you haven't opened it in months. Now let's talk about problem solving. Cats are what scientists call flexible problem solvers. Unlike dogs, who often rely on repetition and training to solve problems, cats use observational learning and trial and error. They watch, they experiment, they adapt. In laboratory studies, cats have shown the ability to use tools, though not as extensively as primates. They can learn to pull strings to retrieve food. They can figure out how to open doors by watching humans. Some cats have even learned to turn on faucets, open cabinets, or manipulate complex latches. But the most impressive part? Cats can generalize solutions. If they figure out how to open one door, they can often apply that knowledge to other doors, even if the mechanism is slightly different. This is abstract thinking, and it's a sign of genuine intelligence. Let's talk about cat emotions, because the science here is more complex than most people realize. Cats absolutely experience basic emotions like fear, joy, anger, and contentment. But do they experience more complex emotions like jealousy, guilt, or grief? The answer is yes, but with nuance. Cats show clear signs of jealousy when another cat or pet receives attention. They demonstrate grief when a companion dies, often searching for them, crying, or showing reduced appetite. But guilt, that's trickier. What we interpret as guilt is usually just fear of punishment based on your reaction, not actual remorse. Here's something most people don't know. Cats have emotional contagion. They pick up on the emotions of other cats and even humans. If you're stressed, your cat's cortisol levels rise. If another cat in the household is anxious, that anxiety can spread. This is why multi-cat households can sometimes spiral into collective stress, and why your mood directly impacts your cat's emotional state. Research from Oakland University found that cats are actually quite good at reading human facial expressions. They can distinguish between happy and angry faces, and they respond differently to each. When you smile at your cat, they know. When you're angry, they know that too. They're watching you far more carefully than you might think. Now, let's talk about cat sleep and dreams, because this ties directly into cognition. Cats spend about 70% of their lives asleep, but not all sleep is the same. They cycle between light sleep, deep sleep, and REM sleep, just like humans. During REM sleep, cats dream. We know this because their brains show the same patterns as dreaming humans, and because you can see them twitching, moving their paws, or making small sounds. What are they dreaming about? Based on the research, probably experiences from their day, hunting, playing, interactions with you. Their brains are processing and consolidating memories. Here's the fascinating part. Sleep is critical for learning in cats. Studies show that cats who get adequate REM sleep learn new tasks faster and remember them better. If you're trying to train your cat, making sure they're getting good sleep actually improves the results. As cats age, their cognitive abilities change, and this is something every senior cat owner needs to understand. Feline cognitive dysfunction, essentially dementia in cats, affects a significant percentage of cats over 15 years old. The signs include disorientation, changes in sleep-wake cycles, forgetting where the litter box is, increased vocalization, especially at night, and changes in social interaction. But here's the good news. Cognitive decline isn't inevitable, and it can be slowed. Environmental enrichment, puzzle feeders, training exercises, social interaction, and even certain supplements like omega-3 fatty acids and antioxidants have been shown to help maintain cognitive function in aging cats. One more thing about advanced cat cognition. Cats understand object permanence far better than we used to think. Object permanence is the understanding that objects continue to exist even when you can't see them. Human babies develop this around 8 months. Cats have it from kittenhood. But cats also understand what researchers call invisible displacement. If you show a cat a toy, hide it behind your back, then secretly place it under a cup. While it's behind your back, the cat can still figure out where it went. That's advanced reasoning that requires mental representation of objects and events you can't directly observe. So what does all of this mean for you as a cat owner? It means your cat is far more intelligent, emotionally complex, and cognitively sophisticated than most people give them credit for. They're watching you, learning from you, remembering everything, and building a complex mental model of their world and relationships. Treat them with the respect that level of intelligence deserves. Understanding feline cognition changes how you interact with your cat. It explains why they remember that one time you accidentally stepped on their tail 5 years ago, why they know exactly when it's dinner time even when the clocks change, why they can manipulate you so effectively when they want something. They're not just operating on instinct, they're thinking, planning, and remembering. And that makes the relationship all the more remarkable. Section 2. Complete Kitten Development Guide. Birth to 1 year. Let's talk about kittens, and I don't mean just the basics of keeping a kitten alive and fed. We're going to walk through the complete developmental process from birth to 1 year, week by week, explaining exactly what's happening physically, neurologically, and behaviorally. Because if you understand these critical windows of development, you can raise a kitten that becomes the most well-adjusted, confident, healthy adult cat possible. Most people don't realize just how important the first year is. The experiences a kitten has during this time literally shape their brain structure, their personality, and their behavior for the rest of their lives. Miss certain critical windows, and you can't go back. But if you do things right during these sensitive periods, you set your cat up for success forever. Let's start at the very beginning, birth to 2 weeks old. This is called the neonatal period. Kittens are born blind, deaf, and completely helpless. They can't regulate their own body temperature. They can't eliminate waste without stimulation from their mother. All they can do is crawl in slow circles, searching for warmth and milk. During this stage, their eyes are sealed shut, usually opening somewhere between 7 and 14 days. But even when the eyes open, they can't see clearly yet. Everything is blurry. Their ear canals are also sealed at birth, opening around the same time as the eyes. Here's what's critical during this stage: temperature. Kittens can't shiver to generate heat, so they rely entirely on their mother or an external heat source. If you're hand-raising orphaned kittens, this is life or death. The ambient temperature needs to be around 85 to 90 degrees Fahrenheit for the first week, gradually decreasing as they get older. Feeding happens every 2 to 3 hours, around the clock. If the mother is present and healthy, she handles this. If you're bottle feeding, welcome to sleepless nights. Kittens need about 8 milliliters of formula per ounce of body weight per day, divided into frequent small meals. The other critical thing during this stage is stimulation for elimination. Mother cats lick their kitten's genital area to stimulate urination and defecation. If you're raising orphaned kittens, you have to replicate this with a warm, damp cloth after every feeding. It sounds strange, but it's absolutely essential. Now, 2 to 4 weeks old. This is when things start getting interesting. The eyes are open, though vision is still developing. The ear canals are open, and hearing is starting to work. Kittens begin to respond to sounds, though they can't localize them well yet. Around 3 weeks, something magical happens. They start to walk. It's wobbly and uncoordinated at first, but suddenly these helpless little potatoes are mobile. This is also when baby teeth start to emerge. By 4 weeks, they have a full set of tiny, needle-sharp baby teeth. This is the beginning of the socialization window, and this is absolutely critical. From about 2 weeks to 7 weeks of age, kittens are in their primary socialization period. This is when they learn what's safe, what's dangerous, who to trust, and how to interact with the world. During this window, kittens need to be gently handled by humans, multiple different humans if possible. They need to experience different textures, sounds, and environments. Research shows that kittens handled gently for just 5 to 15 minutes a day during this period grow up to be significantly more social, confident, and adaptable than kittens who aren't. But here's the key: the handling has to be positive. Rough handling, scary experiences, or pain during this window can create lifelong fears and behavioral problems. This is why it's so important that kittens stay with their mother and litter mates during this time. They're learning crucial social skills. 4 to 8 weeks old. This is prime socialization time. Kittens are now mobile, playful, and learning at an incredible rate. They're wrestling with their siblings, learning bite inhibition when a playmate yelps, understanding boundaries, and developing their hunting skills through play. Around 4 to 5 weeks, kittens start showing interest in solid food. This is the beginning of weaning. The mother will gradually nurse less, and kittens will transition to eating on their own. By 8 weeks, most kittens are fully weaned, though some may nurse occasionally for comfort, even after that. This is also when litter box training typically happens. Kittens have an instinct to eliminate in loose substrate and cover it. If you provide a litter box with low sides and fine-grained litter, most kittens will figure it out with minimal intervention, especially if they're watching their mother use it. Here's what many people don't understand. 8 weeks is the absolute minimum age to separate a kitten from their mother and litter mates, and 12 weeks is actually better. During weeks 8 through 12, kittens are still learning critical social skills from their family. They're refining their communication, learning bite inhibition, understanding cat body language, and developing confidence. Kittens separated too early often have behavioral problems as adults. They might play too rough, not understanding when they're hurting you. They might have difficulty reading other cats' signals. They might be overly fearful or overly aggressive. The extra 4 weeks makes a massive difference. 8 to 16 weeks old. This is adolescence for kittens. They're coordinated now, fully weaned, litter box trained, and bursting with energy. They're also still in a secondary socialization window, though it's starting to close. This is your last chance to expose them to new experiences in a way that will permanently shape their comfort level with those things. If you want your cat to be comfortable with car rides, start now. If you want them to tolerate nail trims, start now. If you want them to accept being brushed, handled by strangers, or examined by vets, now is the time. This is also when vaccinations begin. The typical schedule starts around 6 to 8 weeks with the first FVRCP vaccine, which protects against feline viral rhinotracheitis, calicivirus, and panleukopenia. Boosters follow every 3 to 4 weeks until around 16 weeks of age. Rabies vaccine is usually given around 12 to 16 weeks. Here's something critical that most people mess up. During this stage, you want to create positive associations with things that will happen throughout your cat's life. Going to the vet, getting into the carrier, being handled, having their paws touched, having their mouth examined. Every single one of these things should be paired with treats, praise, and positive experiences. If the only time your kitten gets put in a carrier is to go to the vet for scary, painful procedures, they're going to hate the carrier forever. But if you leave the carrier out, feed them in it, give them treats in it, and occasionally just put them in for a short, fun car ride to nowhere, the carrier becomes neutral or even positive, 4 to 6 months old. This is when things get challenging. Your kitten is now a teenager. They're testing boundaries, pushing limits, and sometimes driving you absolutely crazy. They have seemingly infinite energy. They're into everything. They're fearless in ways that can be genuinely dangerous. This is also when sexual maturity starts to approach. Somewhere between 4 and 6 months, depending on the individual cat and the breed, kittens can start going into heat or developing mating behaviors. This is why veterinarians recommend spaying or neutering around 5 to 6 months of age, before the first heat cycle in females. Spaying or neutering at this age has multiple benefits. It prevents unwanted litters, obviously, but it also reduces certain health risks, like mammary cancer in females and testicular cancer in males. And it prevents behaviors associated with being intact, like spraying, yowling, trying to escape, and aggression. During this stage, training becomes really important. Kittens are smart and food-motivated, which makes this an ideal time to teach basic commands, tricks, and appropriate behaviors. We'll talk more about training in a later section, but the key point is that 6-month-old kittens are like sponges. They can learn almost anything if you make it fun and rewarding. This is also when you need to establish rules and boundaries. If you don't want your adult cat on the kitchen counter, don't allow your kitten on the counter. Consistency now saves you years of frustration later. Kittens are testing to see what they can get away with. Whatever you allow now becomes their expectation for how things work. 6 to 12 months old, your kitten is growing into a young adult. They're slowing down slightly from the insane teenage energy, though they're still far more active than they will be as adults. Their adult personality is starting to emerge. You can see who they're going to be. Some cats remain playful and kitten-like well into adulthood. Others become more dignified and calm. Some are social butterflies. Others are independent loners. Genetics plays a role, but so do all those early experiences we've been talking about. By 12 months, most cats have reached their full adult size, though some large breeds like Maine Coons will continue growing until around 3 to 4 years old. Their baby teeth have all fallen out and been replaced by adult teeth. Their coordination is fully developed. They're physically mature. Behaviorally, though, they might still have some growing up to do. Many cats don't reach full emotional maturity until around 2 to 3 years old, so if your 1-year-old cat is still acting a bit crazy, that's normal. They're technically adults, but they're young adults. Give them time. Here's the thing about kitten development that I want you to really understand. Every single stage matters. The experiences your kitten has during each of these windows shape who they become. A kitten who is gently handled during the socialization period, kept with their mother until 12 weeks, properly vaccinated, consistently trained, and given appropriate boundaries, grows up to be a confident, well-adjusted, friendly adult cat. a kitten who misses those critical periods, who is separated too early, who has scary experiences during sensitive windows, who isn't properly socialized, often struggles with behavioral problems, fear, aggression, or anxiety as an adult. And while you can work on those issues later, it's so much harder than just doing it right from the start. If you're getting a kitten, use this information. Handle them gently every day. Expose them to new things gradually and positively. Keep them with their mother and siblings until at least 12 weeks if possible. Start training early. Create positive associations with necessary experiences. Spay or neuter at the appropriate age, and give them the time, attention, and patience they need during this critical first year. If you do all of that, you won't just have a cat. You'll have a well-adjusted, confident, loving companion for the next 15 to 20 years. And that is absolutely worth the effort. Section 3. Advanced Cat Training, Tricks and Commands. Let's address the elephant in the room. Most people think cats can't be trained. They think training is for dogs, and cats are too independent, too stubborn, or too aloof to bother learning tricks or commands. And I'm here to tell you that's completely wrong. Cats are absolutely trainable. In fact, they're often easier to train than dogs in some ways, because they're highly food-motivated and incredibly intelligent. The reason most people fail at training cats has nothing to do with the cat's ability to learn. It's because they're using the wrong methods, the wrong timing, or the wrong motivation. Dogs are pack animals who are bred to please humans and respond to social pressure. Cats are solitary hunters who are bred to solve problems and get what they want through intelligence and persistence. You can't train a cat the way you train a dog, but if you understand what motivates a cat and use the right techniques, you can teach them almost anything. So let's talk about how to actually train your cat. Starting with the foundation of all modern cat training, clicker training. Clicker training is a form of positive reinforcement training that uses a small device that makes a clicking sound. The click marks the exact moment your cat does the behavior you want, and it's immediately followed by a reward, usually a small treat. The beauty of clicker training is that it's incredibly precise. Your cat knows exactly which behavior earned the reward because the click happens at the exact moment they do it. Here's how you start. First, you need to charge the clicker. This means creating an association in your cat's mind between the click sound and a reward. It's simple. Click, then immediately give your cat a tiny treat. Click, treat. Click, treat. Repeat this about 10 to 15 times in a short session. You'll know the clicker is charged when your cat's ears perk up, or they look at you expectantly when they hear the click, even if they can't see the treat yet. That's the conditioned response. The click now means good things are coming. Now you can use the clicker to shape behavior. Let's start with the easiest trick. Sit. Most cats naturally sit multiple times a day, so you're just capturing a behavior they already do and putting it on command. Here's the method. Hold a treat above your cat's head, slightly behind their eye line. As they look up at the treat, their natural body mechanics will cause them to sit. The moment their butt touches the ground, click and immediately give the treat. Repeat this several times until your cat starts sitting as soon as you hold the treat above their head. Now add the verbal command. Just before you lure them into the sit position, say the word sit. Lure, they sit, click, treat. After enough repetitions, your cat will start sitting when they hear the word, even without the lure. That's when you know they've learned the command. Let's move to something more impressive. High five. This one looks fancy, but it's actually quite simple because cats naturally lift their paws to bat at things. Hold a treat in your closed fist at about your cat's shoulder height. Most cats will reach out with their paw to try to open your hand and get the treat. The instant their paw touches your hand, click and open your hand to give them the treat. Repeat this until they're reliably pawing at your hand. Now start shaping it to look more like a high five. Gradually open your hand so it's flat instead of a fist. Click and treat when they touch your open palm. Eventually, add the verbal cue high five just before presenting your hand. With practice, your cat will raise their paw and tap your hand when you say the command. It's impressive and adorable. Here's one that surprises people. Come when called. Yes, cats can learn to come when you call them, and this isn't just a party trick. It's genuinely useful and can even be a safety tool if your cat ever gets outside. Start in a small room with minimal distractions. Say your cat's name followed by come, then immediately shake a bag of treats or their favorite toy. When they come to you, even if it's just a few steps, click and give them a jackpot reward, multiple treats. Make it a huge deal. Gradually increase the distance and add distractions. Practice in different rooms. Practice when they're doing something else. The key is making coming to you the most rewarding thing they could possibly do in that moment. Over time, your cat will reliably come when called because they know something amazing is about to happen. Let's talk about fetch, because yes, some cats can absolutely learn to fetch. It's easier with cats who already like to carry things in their mouths, but even cats who don't naturally do this can sometimes learn. Start by finding a small toy your cat loves. Toss it a short distance. If your cat goes after it, click and call them back to you enthusiastically. When they come near you with the toy, click and treat. If they drop the toy near you, give them an extra treat and immediately throw it again. The key is making the game itself rewarding. Some cats figure out that bringing the toy back means you'll throw it again, which is what they actually want. For other cats, you need to use treats to reinforce bringing it back. Not every cat will become obsessed with fetch, but many enjoy it, and it's excellent exercise and mental stimulation. Now, something more advanced, jump. Teaching your cat to jump on command is useful and builds confidence. Start with a very low height, like a step or a small box. Lure your cat onto it with a treat. Click when all 4 paws are on it and reward. Add the verbal cue jump. Gradually increase the height as your cat gets confident. You can teach them to jump onto specific objects, jump through hoops, or even jump over obstacles on cue. This kind of training is what you see in cat agility competitions, and it's fantastic enrichment. Here's another practical one: stay. This is harder for cats than for dogs because cats aren't naturally inclined to hold still when they could be investigating something interesting, but it's doable. Start by asking your cat to sit. As soon as they sit, click and treat. Gradually delay the click by half a second, then a full second, then 2 seconds. If your cat breaks the sit before you click, don't reward. Just reset and try again with a shorter duration. Add the verbal command stay once they're reliably holding the sit for a few seconds. Gradually increase the duration and add distance. Take 1 step back, return, click, treat. Take 2 steps back, return, click, treat. This takes patience, but cats can learn to stay in position for impressive lengths of time if the reinforcement history is strong enough. Let's talk about targeting. This is teaching your cat to touch a specific object, usually a target stick or even your finger, with their nose or paw. It's the foundation for more complex tricks and behaviors. Hold out your finger or a target stick near your cat's face. Most cats will sniff it out of curiosity. The instant their nose touches it, click and treat. Repeat until they're reliably touching the target every time you present it. Then add the cue touch. Once they understand targeting, you can use it to guide them into positions or movements. You can lure them through an agility course, teach them to turn in circles, or get them to go into their carrier without force. Targeting is incredibly versatile. Speaking of the carrier, let's talk about training your cat to voluntarily go into their carrier. This is one of the most useful things you can teach, and it makes vet visits so much less stressful for everyone. Leave the carrier out in your home as a normal piece of furniture. Put a soft blanket inside and maybe some treats. Let your cat explore it on their own terms. When they go inside, even just to investigate, click and toss a treat in. Do this repeatedly over days or weeks. Gradually shape it so they go all the way inside. Then add a verbal cue like kennel or carrier. Eventually, work up to closing the door for just a second, then opening it and treating. Slowly increase the duration. The goal is for your cat to see the carrier as a safe, rewarding space, not a trap. Here's one that requires more advanced training: spin. This teaches your cat to turn in a complete circle on command. Use a treat to lure your cat's nose in a circular motion. As they follow the treat, they'll naturally turn their body. When they complete the full circle, click and give the treat. Add the verbal cue spin and gradually fade the lure so they're responding to the word and your hand signal rather than following food. Some cats pick this up in a single session, others take longer. It depends on the individual. Now let's address the challenges you might face when training cats. The biggest one is motivation. Cats aren't interested in pleasing you for the sake of it. They're interested in what's in it for them. So you need to find what your cat values most. For most cats, it's food. But it might be a specific toy, playtime, or even affection. Use high-value rewards. Don't train with regular kibble. Use tiny pieces of cooked chicken, tuna, commercial cat treats, or whatever your cat goes absolutely crazy for. The reward needs to be worth the effort of learning. Timing is critical. The click or reward needs to happen within half a second of the behavior. If you're too slow, your cat won't connect the reward with the action, and they won't learn what you want. Keep sessions short. Cats have shorter attention spans than dogs. 5 to 10 minutes is plenty. If your cat loses interest or gets frustrated, stop. End on a success, even if it's something simple they already know, so they finish the session feeling good. Consistency matters. Use the same words for the same commands every time. If you say sit one day and sit down the next, you're confusing your cat. Pick your cues and stick with them. Never punish mistakes. If your cat doesn't do what you want, don't scold, yell, or punish. Just withhold the reward and try again. Punishment damages the trust that makes training possible in the first place. Some cats are easier to train than others. Food-motivated cats learn faster. Confident, playful cats often enjoy training more. But almost any cat can learn at least basic commands if you're patient and use the right methods. Here's the thing about cat training that most people don't understand. It's not just about the tricks. Yes, it's fun to show off that your cat can give high fives or jump through a hoop. But the real benefit of training is the mental stimulation it provides. Cats are intelligent predators who are built to solve problems and hunt. In our homes, they often don't get enough mental challenge. Training fills that gap. A trained cat is usually a happier cat. They're engaged, they're using their brain, they're spending quality time with you. Training builds confidence, especially in shy cats. It gives them a sense of control and accomplishment. And it strengthens your bond because you're communicating in a way your cat understands. Plus, training makes life easier. A cat who comes when called is safer. A cat who willingly goes into their carrier makes vet visits less traumatic. A cat who knows sit and stay is easier to manage during nail trims or medication time. So don't think of cat training as frivolous or unnecessary. It's enrichment, it's communication, it's relationship building. And it's evidence that cats are far more capable and intelligent than most people give them credit for. Start small. Pick one simple trick. Get a clicker and some really good treats. Spend 5 minutes a day working on it. Be patient. Celebrate small progress. And watch as your cat surprises you with just how much they can learn. When you meet them where they are and work with their nature instead of against it, cats aren't stubborn. They're not too independent to train. They're just operating on different motivations than dogs. Once you understand that and adjust your approach accordingly, a whole new world of possibilities opens up. Your cat can learn. They want to learn. You just have to show them that learning is fun, rewarding, and worth their time. Section 4. Feline genetics and breeding. Let's talk about genetics. Now, before your eyes glaze over, I promise this isn't going to be a boring high school biology lecture. Understanding feline genetics is actually fascinating, and it has real practical applications, whether you're considering breeding, choosing a cat, or just trying to understand why your cat looks the way they do. We're going to cover the basics of color genetics, how genetic health conditions work, what responsible breeding actually looks like, which breeds are prone to which genetic disorders, and whether DNA testing for your cat is worth it. Let's start with something visual and fun, coat color genetics. Have you ever wondered why some cats are orange and others are black? Why some have stripes and others don't? Why calico cats are almost always female? It all comes down to genetics, and once you understand the basics, it's like solving a puzzle. Every cat has 2 copies of each gene, one from their mother and one from their father. Some genes are dominant, meaning they only need 1 copy to show up. Others are recessive, meaning they need 2 copies. Let's start with the most basic coat colors, black and orange. The gene for orange color is actually located on the X chromosome. This is why orange cats show interesting patterns based on sex. Male cats have 1 X and 1 Y chromosome. If their single X chromosome carries the orange gene, they're orange. Simple. Female cats have 2 X chromosomes. If both carry the orange gene, they're orange. If neither does, they're not orange. But if 1 X has orange and 1 doesn't, something magical happens. They become calico, or tortoiseshell. Here's why. In female cats, one of the 2 X chromosomes gets randomly inactivated in each cell early in development. So some cells express the orange gene, and some express the non-orange gene. This creates the patchy pattern we see in calico and tortoiseshell cats. It's called X inactivation, and it's why calico and tortoiseshell cats are almost always female. Males can only be calico if they have a genetic abnormality giving them 2 X chromosomes, which is extremely rare and usually comes with health problems. Now let's talk about black, chocolate, and cinnamon. These are all variations controlled by the same gene, just different versions of it. Black is dominant. Chocolate is recessive to black, but dominant to cinnamon. Cinnamon is the most recessive. So a cat needs 2 copies of the chocolate gene to be chocolate and 2 copies of the cinnamon gene to be cinnamon. Then there's dilution. The dilution gene takes bold colors and softens them. Black becomes blue, which is actually a soft gray. Chocolate becomes lilac. Orange becomes cream. Cinnamon becomes fawn. Dilution is recessive. So a cat needs 2 copies of the dilute gene to show the diluted color. White is a completely different story. There are actually several ways a cat can be white. True white cats have a gene that masks all other color genes. It's like painting over whatever color they would have been. These white cats are often, though not always, deaf, especially if they have blue eyes. The gene that causes white also sometimes causes deafness by affecting the development of structures in the inner ear. Then there's the white spotting gene, which creates patches of white. This is what gives you tuxedo cats, cats with white paws, or cats with white chests. The amount of white varies depending on the specific version of the gene and other genetic factors. Now, patterns. Tabby patterns are actually the default pattern for cats. All cats are genetically tabby. Some cats just have an additional gene that masks the tabby pattern, making them appear solid-colored. But if you look at a solid black cat in bright sunlight, you can often see faint tabby markings underneath. There are several tabby patterns. Mackerel tabby has narrow stripes like a tiger. Classic tabby has swirls and a bullseye pattern on the sides. Spotted tabby has spots instead of stripes. Tick tabby looks solid from a distance, but each individual hair has bands of color. The specific tabby pattern is controlled by different genes. The gene that masks tabby, creating solid-colored cats, is called the agouti gene. Cats with 2 copies of the non-agouti version appear solid, but even solid cats are still genetically tabby underneath. That's why you sometimes see ghost tabby markings on solid kittens. The pattern is there, just hidden. Understanding these genetics isn't just academic, it affects breeding. If you breed 2 dilute cats together, all their kittens will be dilute because both parents can only pass on dilute genes. If you breed a solid cat to a tabby, whether the kittens are solid or tabby depends on whether the solid parent carries a hidden tabby gene. Now let's talk about genetic health issues, because this is where genetics gets really serious. Some breeds are prone to specific genetic disorders that are passed down through families, and responsible breeders need to test for these and make informed decisions to avoid producing affected kittens. Let's start with hypertrophic cardiomyopathy, or HCM. This is a heart condition where the walls of the heart become abnormally thick, reducing the heart's ability to pump blood effectively. It's one of the most common heart conditions in cats, and it has a genetic component in certain breeds. Maine Coons and Ragdolls are particularly prone to HCM, and genetic tests are available to identify cats who carry the mutation. But here's the tricky part. Not all cats with the mutation develop the disease, and some cats without the mutation still get HCM. Genetics is part of the picture, but it's not the whole story. Still, responsible breeders of these breeds should test their breeding cats and avoid breeding cats with the mutation. Polycystic kidney disease, or PKD, is another genetic disorder, most common in Persian cats and related breeds. It causes cysts to develop in the kidneys over time, eventually leading to kidney failure. This one is autosomal dominant, meaning a cat only needs one copy of the mutation to be affected. Genetic testing is available, and responsible Persian breeders test their cats and don't breed affected individuals. Progressive retinal atrophy, or PRA, is a genetic eye disease that leads to blindness. It's seen in Abyssinians, Somalis, and some other breeds. Testing is available, and again, responsible breeders test and make decisions to avoid producing affected kittens. Spinal muscular atrophy is a genetic disorder seen in Maine Coons that affects the muscles and leads to weakness and muscle wasting. It's recessive, so kittens need two copies to be affected. Breeders can test their cats and avoid breeding two carriers together, which would produce affected kittens. Scottish Folds have a unique genetic situation. The folded ears that define the breed are caused by a cartilage mutation, but this same mutation affects cartilage throughout the body. Cats with two copies of the fold gene develop severe skeletal abnormalities and pain. This is why ethical breeders never breed two folded cats together. They breed a folded cat to a straight-eared cat, producing some folded and some straight-eared kittens, all of whom have only one copy of the mutation. But even with one copy, Scottish Folds are at higher risk for arthritis and joint problems as they age. This has led to controversy about whether the breed should exist at all. Some countries have banned the breeding of Scottish Folds because of welfare concerns. It's a complex ethical issue with strong opinions on both sides. Manx cats, known for being tailless or having short tails, have a similar issue. The gene that causes the short tail can also cause spinal defects, particularly a condition called Manx syndrome, which can include spinal bifida, fused vertebrae, and problems with bowel and bladder control. Responsible Manx breeders understand these risks and breed carefully to minimize them. Let's talk about what responsible breeding actually looks like, because there's a huge difference between responsible preservation breeding and backyard breeding or kitten mills. Responsible breeders aren't in it for money. Breeding cats properly is expensive and time-consuming. The goal is to improve the breed, produce healthy, well-adjusted kittens, and preserve breed characteristics. A responsible breeder starts with health testing. They test their breeding cats for genetic conditions relevant to the breed. They have breeding cats examined by veterinarians, including cardiac ultrasounds for breeds prone to HCM. They only breed cats who are healthy, have good temperaments, and conform to breed standards. They carefully select pairings based on genetics, health, temperament, and conformation. They're not just throwing any two cats together, they're thinking about what traits each parent brings and what the kittens are likely to be like. They provide excellent prenatal care for pregnant queens. They're present for births and ready to intervene if complications arise. They raise kittens in their home, socializing them extensively, handling them daily, exposing them to normal household sights and sounds. They keep kittens until at least 12 weeks, preferably longer. They provide age-appropriate veterinary care, vaccinations, and deworming. They spay or neuter kittens before they go to homes unless the kitten is going to another responsible breeder. They screen potential buyers carefully and are available for support for the entire life of the cat. They have contracts that require buyers to return the cat to them if they can't keep it, preventing cats from ending up in shelters. They genuinely care about every kitten they produce and want to ensure it has the best possible life. Compare this to backyard breeders who breed their pet cat because they think kittens are cute or they want to make money. No health testing, no careful selection. Kittens might be sent to homes at 6 weeks old, poorly socialized, not vetted, no support. This is how genetic problems get perpetuated and how poorly adjusted cats end up in shelters. Kitten mills are even worse. They're essentially factories producing as many kittens as possible with no regard for health, welfare, or genetics. Breeding cats are kept in poor conditions, overbred and discarded when they're no longer productive. Kittens are separated far too young and sold through pet stores or online. These operations are driven purely by profit, and the suffering they cause is immense. Now, DNA testing for cats. Is it worth it? It depends on what you're testing for and why. If you have a purebred cat from a breed prone to genetic conditions, testing can be valuable. Knowing whether your Maine Coon carries the HCM mutation or whether your Persian has PKD can help you make informed decisions about their care and what to watch for. There are also DNA tests for traits like coat color and pattern, which can be interesting if you're curious about your cat's genetics or if you're breeding and want to predict what kittens will look like. Some tests can identify breed ancestry in mixed breed cats, though these are less accurate than dog breed tests because cat breeds are more genetically similar to each other. For the average pet owner with a mixed breed cat, DNA testing is mostly just fun and interesting rather than medically necessary. But if you're buying from a breeder, you should absolutely ask what health testing has been done on the parents. Responsible breeders will happily provide results. Here's the bottom line on genetics and breeding. Genetics matter. They affect appearance, health, temperament, and risk for disease. Understanding genetics helps you make informed decisions whether you're choosing a cat, breeding cats, or just understanding your own cat better. If you're considering buying from a breeder, choose a responsible one who health tests, breeds for temperament and health rather than just appearance, raises kittens properly, and stands behind their cats for life. If you're considering breeding your cat, please don't unless you're prepared to do it responsibly with health testing, proper care, and a genuine commitment to improving the breed. And if you just want to enjoy your cat without worrying about genetics, that's totally fine too. Most cats, regardless of their genetic background, live long, healthy lives. But knowing the science behind why your cat looks the way they do, or understanding that your ragdoll might need cardiac screening, or appreciating the complexity of what creates a tortoiseshell pattern, that's knowledge that enriches your relationship with your cat. Genetics is complicated, but it's also beautiful. Every cat is the result of thousands of years of evolution and decades of selective breeding, all encoded in their DNA. And that's pretty amazing when you think about it. Section 5. Advanced nutrition and raw feeding. Let's talk about something controversial in the cat world, nutrition. And specifically, raw feeding, homemade diets, and advanced nutritional strategies that go beyond just opening a can of food or pouring kibble into a bowl. I want to be very clear from the start. I'm not here to tell you that commercial cat food is poison or that you're a bad cat owner if you feed it. Quality commercial cat foods are nutritionally complete, convenient, and perfectly fine for most cats. But I also think it's important to understand the science of feline nutrition, what cats actually need, and what your options are if you want to take a more hands-on approach to feeding. Let's start with the fundamentals of feline nutrition, because you can't make informed decisions about diet without understanding what cats actually need. Cats are obligate carnivores. This isn't just a preference, it's a biological requirement. Their bodies have evolved to derive nutrition primarily from animal tissue. Unlike dogs, who are omnivores and can survive on a variety of foods, cats lack the ability to synthesize certain nutrients from plant sources. They require preformed vitamin A from animal tissue. They can't convert beta-carotene from plants into vitamin A the way dogs and humans can. They need taurine, an amino acid found primarily in animal tissue, and they can't make enough of it themselves. They need arachidonic acid, a fatty acid abundant in animal fat. They need high levels of protein, much higher than dogs. This is why cats can't be vegetarian or vegan without serious health consequences. It's not a moral judgment, it's simple biology. Their digestive systems, their metabolisms, their entire physiology is designed for a meat-based diet. In the wild, cats eat whole prey: mice, birds, rabbits. They consume muscle meat, organs, bones, a small amount of stomach contents from the prey, and very little plant matter. This diet is high in protein, moderate in fat, very low in carbohydrates, and contains significant moisture content since prey animals are about 70% water. Now compare that to most commercial dry cat foods: much lower protein as a percentage of calories, much higher carbohydrates, sometimes 30 to 40% or more, very low moisture, usually about 10%. This is not what a cat's body is designed to process. Does this mean dry food is terrible and will kill your cat? No. Cats are adaptable, and millions of cats live long, healthy lives on dry food. But it does mean that dry food is a compromise, a convenience-based food that doesn't perfectly match a cat's evolutionary diet. And for some cats, particularly those with certain health conditions, that compromise can be problematic. So let's talk about raw feeding. The idea behind raw feeding is to replicate that natural prey-based diet as closely as possible, feeding raw meat, bones, and organs in proportions that mimic what a cat would eat in the wild. There are different approaches to raw feeding. Some people feed whole prey, literally frozen mice or chicks purchased from reptile supply companies. Others feed a ground raw diet where muscle meat, organs, and ground bone are mixed together. Some make their own raw food at home following specific recipes. Others buy commercially prepared raw food that's been nutritionally balanced. Let's talk about the potential benefits of raw feeding, because there are some. Many raw feeders report better dental health in their cats. Chewing raw meaty bones can help clean teeth mechanically. Others report improved coat quality, more energy, better weight management, smaller and less smelly stools, and resolution of certain digestive issues. Some of these benefits are anecdotal, but some make biological sense. The high moisture content of raw food can improve hydration, which is beneficial for kidney and urinary tract health. The low carbohydrate content can help with weight management and may be beneficial for diabetic cats. The high protein content aligns with a cat's natural nutritional needs. But let's also talk about the risks, because they're real, and you need to understand them before deciding to feed raw. The biggest concern is bacterial contamination. Raw meat can contain salmonella, E. coli, listeria, and other pathogens. Cats have relatively resistant digestive systems and can often handle bacteria that would make humans sick, but they can still get ill from contaminated food, and they can shed these bacteria in their feces, potentially exposing humans in the household. This is particularly concerning if you have young children, elderly people, pregnant women, or immunocompromised individuals in your home. The risk of zoonotic disease transmission from cat to human is something you need to take seriously. Then there's nutritional balance. It's not enough to just feed raw chicken. A nutritionally complete diet needs the right ratios of muscle meat, organs, and bone, plus added supplements like taurine and vitamin E. Get the ratios wrong and you can create serious nutritional deficiencies or imbalances over time. Too much bone causes constipation and can lead to dangerously high calcium levels. Too little bone leads to calcium deficiency and potential metabolic bone disease. Not enough taurine causes dilated cardiomyopathy, a serious heart condition. Not enough vitamin E can cause a painful condition called steatitis or yellow fat disease. If you're going to feed raw, you need to follow a balanced recipe created by a veterinary nutritionist, or you need to use a commercially prepared raw food that's been formulated to be nutritionally complete. Just making it up as you go along is a recipe for disaster. Safety is critical if you're handling raw meat. Keep it frozen until you're ready to use it. Thaw it in the refrigerator, not on the counter. Use separate cutting boards and utensils for raw cat food and human food. Clean all surfaces thoroughly with hot soapy water or disinfectant. Wash your hands after handling raw meat. Don't let your cat lick your face after they've eaten raw food. Now let's talk about an alternative that addresses some of the concerns about raw feeding. Homemade cooked diets. You can cook meat and organs, which kills bacteria, and still create a nutritionally complete diet if you follow proper recipes and add appropriate supplements. Cooking does destroy some nutrients, particularly taurine, so you need to supplement more heavily than with raw, but you eliminate the bacterial risk. This can be a good middle ground for people who want control over their cat's diet but aren't comfortable with raw feeding. Again, you can't just cook chicken and call it a balanced diet. You need to follow recipes created by board-certified veterinary nutritionists. The website for the American College of Veterinary Nutrition has resources, and there are books specifically about homemade cat diets that provide balanced recipes. Whether you're feeding raw, cooked homemade, or commercial food, supplements can play a role in optimizing your cat's nutrition. Let's talk about what's actually useful versus what's marketing hype. Omega-3 fatty acids, particularly EPA and DHA from fish oil, have anti-inflammatory properties and can be beneficial for cats with arthritis, kidney disease, inflammatory bowel disease, or certain skin conditions. They may also support cognitive function in senior cats. Just make sure the fish oil is specifically formulated for cats and contains vitamin E to prevent oxidation. Probiotics can be helpful for cats with digestive issues, particularly during or after antibiotic treatment. They help maintain healthy gut bacteria. Not all probiotics are created equal, so choose veterinary-approved products with research backing. Digestive enzymes can help some cats with pancreatic insufficiency or maldigestion, but they're not necessary for healthy cats with normal digestion. Joint supplements like glucosamine and chondroitin are commonly given to cats with arthritis. The evidence for their effectiveness is mixed, but they're generally safe, and some cats do seem to benefit. L-lysine is often recommended for cats with chronic herpes virus infections to reduce flare-ups. Recent research suggests it's less effective than previously thought, but it's harmless, and some cats may still benefit. Here's what you probably don't need: most multivitamins if you're feeding a nutritionally complete commercial diet. Adding unnecessary supplements can actually create imbalances. More is not better when it comes to nutrition. Let's talk about food allergies and elimination diets, because this is an area where many cat owners get confused. True food allergies are actually relatively uncommon in cats. They account for maybe 10 to 15% of skin allergies and a small percentage of digestive issues. The most common food allergens in cats are proteins: chicken, beef, fish, and dairy. Cats can't be allergic to grains or carbohydrates in the same way. They can have digestive issues from too much carbohydrate, but that's not an allergy. If your vet suspects a food allergy, the gold standard for diagnosis is an elimination diet. This means feeding a diet containing a single novel protein source that your cat has never eaten before, plus a single carbohydrate source for 8 to 12 weeks. During this time, absolutely nothing else goes in your cat's mouth. No treats, no flavored medications, nothing. If symptoms improve during the elimination diet, you then do a challenge by reintroducing the original food. If symptoms return, you've confirmed a food allergy. Then you can work to identify the specific trigger by introducing ingredients one at a time. Novel protein diets might use rabbit, venison, duck, or even kangaroo. Prescription hydrolyzed protein diets are another option where the protein is broken down into pieces too small to trigger an immune response. The key with elimination diets is strict compliance. One single treat or bite of something else can invalidate weeks of progress. It requires commitment, but if your cat truly has a food allergy, it's worth it. Now let's talk about weight management, because obesity is one of the most common health problems in cats, and it's directly tied to nutrition. An estimated 30 to 40% of cats are overweight or obese. This increases the risk of diabetes, arthritis, heart disease, and shortens lifespan. Weight loss in cats has to be done carefully. Cats can't safely fast or lose weight rapidly like dogs can. If an overweight cat stops eating suddenly or loses weight too quickly, they can develop hepatic lipidosis, a dangerous liver condition that can be fatal. The safe rate of weight loss for cats is about 1 to 2% of body weight per week. For a 15-pound cat, that's maybe half an ounce to an ounce per week. It's slow. Weight loss in cats takes months, not weeks. The most effective approach combines calorie restriction with increased activity. Calculate your cat's ideal weight, determine their caloric needs for that weight, and feed accordingly. Feed measured amounts rather than free feeding. Increase play and activity to boost metabolism. High-protein, low-carbohydrate diets can be beneficial for weight loss because protein increases satiety and helps preserve muscle mass during weight loss. Some cats do well on prescription weight loss foods. Others do better on high-quality canned food fed in controlled portions. The opposite problem, getting a cat to gain weight, is also nutrition-related. Senior cats, cats with chronic illness, or cats recovering from illness often struggle to maintain weight. High-calorie, highly palatable foods can help. Warming food enhances aroma and palatability. Feeding multiple small meals throughout the day can increase total intake. Sometimes appetite stimulants prescribed by your vet are necessary. Mirtazapine or meropitant can help cats who have lost their appetite due to illness or medication side effects. Hydration is another critical nutritional factor that often gets overlooked. Cats have a low thirst drive because they evolved in desert environments and got most of their water from prey. This makes them prone to chronic mild dehydration, which can contribute to kidney disease and urinary tract problems. Wet food is the easiest way to increase water intake. Even adding water to wet food or feeding watered-down food can help. Providing multiple freshwater sources, using fountain-style water bowls, and even offering ice cubes can encourage drinking. Some cats prefer running water, others prefer still water. Some like water away from their food, others want it nearby. Experiment to find what your cat prefers. Here's my bottom line on nutrition. There's no one-size-fits-all perfect diet. The best diet for your cat depends on their age, health status, activity level, personal preferences, and your own circumstances. A cat with kidney disease needs a different diet than a diabetic cat or a healthy young adult. Commercial cat foods, especially high-quality ones that are primarily meat-based with minimal fillers and carbohydrates, are a perfectly reasonable choice. Wet food is generally better than dry because of the moisture content, but some cats do fine on dry food. Raw feeding can be appropriate if you're willing to do it safely and correctly, using balanced recipes or commercial raw foods, and if you understand and accept the risks. Homemade cooked diets are another option if you follow proper recipes. Whatever you feed, pay attention to your cat's body condition, their energy level, their coat quality, their litter box habits. These are all indicators of whether their nutrition is meeting their needs. And work with your veterinarian, particularly if your cat has health issues that affect dietary requirements. Nutrition is complex, and the more you learn about it, the better equipped you are to make choices that support your cat's health. You don't have to be a nutritionist, but understanding the basics of what cats need and why helps you navigate the overwhelming number of options and make informed decisions. Your cat's diet matters. It affects their health, their longevity, their quality of life. Taking the time to understand nutrition and choose the best option for your individual cat is one of the most important things you can do as a cat owner. Section 6, Cat Dental Care Deep Dive. Let's talk about something that most cat owners completely ignore until it becomes a serious problem: dental health. And I get it, it's not fun. Your cat's breath smells terrible. They don't want you looking in their mouth, and dental care seems complicated and expensive. But here's the reality. Dental disease is one of the most common health problems in cats, affecting over 70% of cats over the age of 3. And it's not just about bad breath or ugly teeth. Dental disease causes pain, affects eating, and can lead to serious systemic health problems, including heart, kidney, and liver disease. So we're going to break down everything you need to know about cat dental health: the anatomy of a cat's mouth, how dental disease develops, what professional dental cleaning actually involves, how to provide home dental care, and how to prevent problems before they start. Let's begin with anatomy, because you can't understand dental disease without knowing what's supposed to be there in the first place. Adult cats have 30 teeth. That's fewer than dogs and far fewer than humans. They have 12 incisors, the small teeth at the front of the mouth, 4 canines, those long, sharp fangs, 10 premolars, and 4 molars in the very back. Kitten teeth are different. Kittens are born toothless. Their baby teeth, called deciduous teeth, start erupting around 2 to 3 weeks of age. By 6 weeks, they have a full set of 26 baby teeth. These baby teeth start falling out around 3 to 4 months of age and are replaced by adult teeth. By 6 months, most cats have their full adult dentition. Each tooth has several parts. The crown is the visible part above the gum line. The root, which you can't see, anchors the tooth in the jawbone. Between the crown and root is the neck of the tooth, where the gum tissue attaches. The outer layer of the crown is enamel, the hardest substance in the body. Under the enamel is dentin, which makes up most of the tooth structure. Inside the tooth is the pulp cavity, which contains blood vessels, nerves, and connective tissue. This is why a broken tooth with exposed pulp is incredibly painful. The gums, or gingiva, are the soft tissue that surrounds the teeth. Healthy gums are pink, firm, and don't bleed when touched. Under the gums, the tooth root is surrounded by the periodontal ligament, which holds the tooth in the bony socket of the jaw. Now let's talk about how dental disease develops, because it's a progressive process that starts small and gets worse over time if left untreated. It begins with plaque. Plaque is a soft, sticky film of bacteria, saliva, and food particles that forms on teeth constantly. You can't prevent plaque formation. It happens naturally. But what matters is what happens to that plaque. If plaque isn't removed through chewing or brushing, it mineralizes. Minerals from the saliva, particularly calcium, bind to the plaque and harden it, turning it into tartar, also called calculus. Unlike plaque, which is soft and can be brushed away, tartar is hard, crusty, and bonded to the tooth surface. It can only be removed with professional scaling. Tartar itself isn't the main problem, though it looks ugly and smells bad. The real issue is what it does to the gums. Tartar buildup at the gum line creates pockets where bacteria thrive. These bacteria produce toxins and trigger an inflammatory response from the immune system. This inflammation of the gums is called gingivitis. Gingivitis is the early stage of dental disease, and it's reversible. If you remove the tartar and plaque, the gums can heal and return to normal. Signs of gingivitis include red, swollen gums, especially along the gum line, and sometimes bleeding when the gums are touched or when your cat eats hard food. But if gingivitis is left untreated, it progresses to periodontitis. This is where things get serious. Periodontitis means the infection and inflammation have spread below the gum line, affecting the periodontal ligament and the bone that holds the tooth in place. As periodontitis progresses, the gums recede, pockets deepen, bone is destroyed, and eventually the tooth becomes loose and may fall out or need to be extracted. This process is painful. Cats are masters at hiding pain, but dental disease hurts. They might still eat because they have to, but they're suffering. Periodontitis is not reversible. Once bone is lost, it doesn't grow back. You can stop the progression with treatment, but you can't undo the damage that's already occurred. This is why prevention and early intervention are so important. Beyond periodontal disease, cats can develop other dental problems. Tooth resorption is one of the most common and most painful. This is a condition where the tooth structure literally dissolves from the inside out, starting at the gum line. The exact cause isn't fully understood, but it may be related to inflammatory processes or metabolic factors. Tooth resorption creates holes in the tooth, exposing the sensitive dentin or even the pulp. It's extremely painful. Cats with tooth resorption may drop food, drool, paw at their mouth, or avoid eating on one side. The only treatment is extraction of the affected tooth. There's no way to repair or restore a tooth with resorption lesions. Stomatitis is another serious dental condition. It's severe inflammation of the entire mouth, including the gums, tongue, throat, and the inside of the cheeks. The cause isn't fully understood, but it seems to be an exaggerated immune response, possibly to bacteria or even to the teeth themselves. Cats with stomatitis are in significant pain. Their mouths are bright red, ulcerated, and angry looking. They may stop eating, drool excessively, have terrible breath, and become withdrawn or aggressive due to pain. Treatment is challenging and often requires extraction of many or even all teeth, along with immune-modulating medications. Broken teeth can happen from trauma, fights, chewing on hard objects, or just bad luck. A broken tooth with an exposed pulp cavity is a dental emergency because the nerve is exposed and infected. It's like having a massive toothache with no relief. Broken teeth need either root canal treatment or extraction. Now let's talk about professional dental cleaning, because this is something most cats will need at some point in their lives. And understanding what's involved helps you make informed decisions. A proper dental cleaning under anesthesia is not just scraping visible tartar off the teeth. It's a comprehensive procedure that addresses disease below the gum line. Here's what happens during a professional dental cleaning. First, your cat is put under general anesthesia. This is necessary for several reasons. It allows complete examination and treatment of all tooth surfaces, including the inside of the teeth and below the gum line. It prevents pain and stress for your cat, and it protects the airway from bacteria and debris that get dislodged during the cleaning. Some people worry about anesthesia, and it's true that there are always risks. But modern anesthesia is very safe, especially when proper protocols are followed. Pre-anesthetic blood work checks, organ function to make sure your cat can metabolize the anesthetic drugs. Intravenous fluids support blood pressure and organ function during the procedure. Monitoring equipment tracks heart rate, breathing, blood pressure, and oxygen levels, and a trained technician monitors your cat continuously throughout. The actual cleaning begins with a thorough oral examination. The veterinarian examines every tooth, checks for pockets, looks for signs of resorption, evaluates the gums, and probes each tooth to assess attachment and look for problems below the gum line. Often, full-mouth dental radiographs are taken. Just like at your dentist, these X-rays show what's happening under the gum line. They can reveal abscessed roots, bone, loss, resorption lesions, and other problems invisible to the eye. Next comes scaling. Using an ultrasonic scaler, the technician removes tartar and plaque from the visible tooth surface and, critically, from below the gum line in the pockets around each tooth. This is where disease occurs, and you can't clean below the gum line without anesthesia. After scaling, the teeth are polished. Scaling creates microscopic scratches on the tooth enamel. If left rough, these scratches become perfect places for plaque and bacteria to stick, leading to faster tartar buildup. Polishing smooths the tooth surface, making it harder for plaque to adhere. If any teeth are damaged, diseased beyond saving, or causing problems, they're extracted during the same procedure. Tooth extraction in cats is surgical. It's not just pulling the tooth out. The gums are often sutured closed after extraction to promote healing and reduce pain. Finally, some veterinarians apply a barrier, sealant, or fluoride treatment to help protect the teeth and slow plaque formation. Your cat recovers from anesthesia under close supervision and goes home the same day in most cases. The cost of professional dental cleaning varies widely depending on where you live, what's found during the procedure, and whether extractions are needed. A straightforward cleaning might cost a few $100s. A cleaning with multiple extractions and complications can cost well over $1,000. It's expensive, but it's also comprehensive medical treatment, not just cosmetic. Some places offer anesthesia-free dental cleanings. I'm going to be blunt here. These are not adequate. They might scrape off visible tartar, making the teeth look better cosmetically, but they don't address disease below the gum line, they don't allow for full examination, they're stressful for the cat, and they can actually make things worse by polishing bacteria deeper into the gum pockets. Professional veterinary organizations do not recommend anesthesia-free dentistry. If your cat needs dental work, do it properly under anesthesia. Now let's talk about home dental care. Because while professional cleanings are sometimes necessary, preventing disease in the first place is always better. And there are things you can do at home to slow or prevent dental disease. The gold standard for home dental care is toothbrushing. Yes, brushing your cat's teeth. I know it sounds ridiculous, but it works. Daily brushing can significantly reduce plaque and tartar buildup and prevent gingivitis. Here's how to do it. Start when your cat is young, if possible, but even older cats can learn to tolerate it with patience. Use a toothbrush designed for cats or a finger brush. Use toothpaste formulated for cats. Never use human toothpaste. It contains ingredients like fluoride and xylitol that are toxic to cats. Cat toothpaste comes in flavors like chicken or fish to make it more appealing. Start slowly. Let your cat lick the toothpaste off your finger, then gently rub your finger along their gums. Gradually introduce the toothbrush, just touching it to their teeth for a few seconds. Reward with treats and praise. Build up to actually brushing, focusing on the outside surfaces of the teeth, especially the large upper premolars and canines, where tartar tends to accumulate most. You don't need to brush the inside surfaces of the teeth as much. Cats' tongues do a decent job of keeping those areas cleaner. Focus on the outside, use gentle circular motions, and keep sessions short, maybe 30 seconds to a minute. Do it daily if possible, or at least several times a week. Not every cat will tolerate brushing, and that's okay. There are alternatives. Dental treats and chews designed to reduce plaque can help. These work mechanically by scraping the teeth as your cat chews. Look for products with the Veterinary Oral Health Council seal, which means they've been tested and shown to be effective. Dental diets are another option. These are kibbles specially designed with a texture and size that encourages chewing and mechanically cleans the teeth. Hill's T/D is one example. Again, look for the VOHC seal. Water additives that reduce bacteria in the mouth can help some cats. You add them to your cat's water bowl, and they work chemically to reduce plaque formation. They're not as effective as brushing, but they're better than nothing. Some people use dental wipes, which are textured pads you rub over your cat's teeth. These can remove some plaque, though they're less effective than brushing because they don't get into the crevices as well. The key with all home dental care is consistency. Doing it once a week isn't enough. Daily is ideal. The goal is to disrupt plaque formation before it has a chance to mineralize into tartar. Now let's talk about prevention strategies beyond just cleaning. Diet matters. Wet food doesn't provide any mechanical cleaning action, so cats on exclusively wet food may develop tartar faster. Some dry food, especially dental diets, can help clean teeth, but you also need to balance this against the other nutritional considerations we discussed earlier. There's no perfect answer. Some cats do well on a mix of wet and dry. Chewing is beneficial. Providing appropriate things for your cat to chew on, like dental chews or certain toys, can help. Just avoid anything too hard. Cats can break teeth on extremely hard objects. Regular veterinary exams are critical. Your vet should examine your cat's mouth at every checkup, looking for early signs of dental disease. Catching problems early means less extensive and less expensive treatment. Watch for signs of dental problems at home. Bad breath is often the first sign. Yes, cat breath isn't pleasant, but it shouldn't be foul or overwhelming. Drooling, especially if it's blood-tinged, is concerning. Difficulty eating, dropping food, chewing on one side only, pawing at the mouth, or sudden changes in eating habits can all indicate dental pain. Facial swelling, especially around the jaw or under the eye, can indicate a tooth root abscess. Any of these signs warrant a vet visit. Here's something most people don't realize. Dental disease doesn't just affect the mouth. Bacteria from infected gums and teeth enter the bloodstream. They can travel to vital organs and cause infections in the heart valves, kidneys, or liver. Chronic dental disease has been linked to reduced lifespan and increased risk of systemic illness. Taking care of your cat's teeth isn't cosmetic. It's a crucial part of overall health care. Dental care is one of those areas where an ounce of prevention truly is worth a pound of cure. Establishing good dental habits early, staying on top of home care, and addressing problems promptly can save your cat from pain, save you from expensive procedures, and add years to your cat's life. I know it's not the most glamorous aspect of cat care, but your cat's mouth matters. Those 30 teeth need to last them 15 to 20 years. Taking care of them is part of being a responsible cat owner. Start today, even if it's just examining your cat's mouth or introducing them to the taste of cat toothpaste. Every small step toward better dental health makes a difference. Section 7. Advanced Litter Box Solutions. Let's talk about one of the most frustrating problems cat owners face: litter box issues. Your cat is peeing outside the box. Maybe they're pooping on the carpet. Maybe they're using the box sometimes, but not others. Maybe they've always been perfect until suddenly they're not, and you're stressed, frustrated, angry, and cleaning up messes constantly. Here's what you need to understand right from the start. When a cat eliminates outside the litter box, they're not doing it to spite you. They're not being vindictive or stubborn. Cats don't think that way. They're either sick, stressed, or the litter box situation isn't meeting their needs. Your job is to figure out which one it is and fix it. We're going to go deep on this: medical versus behavioral diagnosis, step-by-step troubleshooting protocols, how to retrain a cat who's developed bad habits, multi-cat household litter strategies, and alternative litter systems for cats with special needs. Let's start with the single most important rule about litter box problems. Rule out medical issues first, always. Before you do anything else, before you try behavioral modification, before you buy new litter boxes, take your cat to the vet. Why? Because many medical conditions cause inappropriate elimination, and treating the behavior without treating the underlying medical problem doesn't work. Urinary tract infections make cats feel like they need to pee urgently and frequently. They associate the litter box with pain, so they avoid it and try peeing elsewhere, hoping it won't hurt. Bladder stones or crystals cause similar symptoms: painful urination, frequent small amounts, sometimes blood in the urine. Cats with these conditions often strain in the box, cry out, and then start avoiding the box entirely. Feline lower urinary tract disease, or FLUTD, is an umbrella term for various conditions affecting the bladder and urethra. Stress-induced cystitis is particularly common. Inflammation of the bladder triggered by stress causes painful, frequent urination. And yes, the stress that triggers it can come from litter box problems, creating a vicious cycle. Kidney disease causes increased urination. A cat with failing kidneys produces large amounts of dilute urine and might not make it to the box in time, especially at night. Senior cats with kidney disease often have accidents simply because their bodies produce more urine than they can hold. Diabetes also causes increased urination and thirst. A diabetic cat might suddenly start having accidents because the litter box isn't big enough, there aren't enough boxes, or they can't get to the box fast enough when the urge hits. Arthritis makes it painful to get in and out of the litter box, especially boxes with high sides. An arthritic senior cat might avoid the box, not because they don't want to use it, but because climbing in hurts. Cognitive dysfunction in elderly cats can cause confusion and loss of litter box habits. A cat with dementia might forget where the box is, forget why they're standing in front of it, or forget that they're supposed to use it. Constipation makes defecation painful. Cats sometimes associate that pain with the litter box and start pooping elsewhere, hoping it will hurt less in a different location. Digestive issues like inflammatory bowel disease or intestinal parasites can cause urgency, diarrhea, or unpredictable bowel movements that lead to accidents. So here's what you do. When litter box problems start, schedule a vet appointment. Bring a fresh urine sample if possible. The vet will perform a physical exam, likely recommend a urinalysis to check for infection, crystals, blood, or signs of kidney disease, and possibly blood work to evaluate organ function. If a medical problem is found, treat it. Often, once the medical issue is resolved, the litter box behavior improves dramatically. Sometimes the cat has developed a location preference or aversion during the illness that needs additional behavioral work, but treating the medical problem always comes first. Now let's say your vet has ruled out medical issues. The problem is behavioral. This is where detective work begins. You need to figure out exactly what's wrong with the litter box setup from your cat's perspective. Start by asking yourself these questions. How many litter boxes do you have? The rule is 1 box per cat plus 1 extra. So if you have 2 cats, you should have 3 boxes. This isn't just a guideline. It's backed by research. Cats are territorial, and some cats won't share boxes willingly, especially for defecation. Where are the boxes located? They need to be in quiet, low-traffic areas where your cat feels safe and won't be disturbed. A box next to the washing machine that runs at random times? Stressful. A box in a busy hallway where people walk by constantly? Not private enough. A box in the basement that requires going down dark stairs? Scary for some cats, but boxes also can't be too isolated. If your cat has to go through 3 doors and down a flight of stairs to reach the only box, they might not bother, especially if they're elderly, young, or have mobility issues. Strike a balance between privacy and accessibility. What type of boxes are you using? Size matters. A box should be at least 1.5 times the length of your cat, from nose to base of tail. Many commercial litter boxes are too small for average-sized cats, let alone large breeds. Small boxes lead to accidents because there's not enough room to turn around and cover waste properly. Height matters too. Boxes with high sides can be difficult for kittens, elderly cats, or cats with arthritis or mobility issues. Low entry boxes or boxes with one low side for entry make access easier. Covered versus uncovered is another factor. Some cats prefer the privacy of a covered box. Others feel trapped and vulnerable in them, especially if they've ever been ambushed by another cat while using a covered box. Covered boxes also trap odors, which might bother your cat even if you can't smell anything. What litter are you using? Cats have preferences, and most prefer fine-grained, unscented clumping, litter that mimics the texture of sand or soil. Heavily scented litters, coarse pellets, crystal litters, or recycled paper litters work for some cats, but are rejected by others. If you've recently changed litter brands or types, that might be your problem. Cats don't like change. Even switching from one brand of clumping clay litter to another can trigger box avoidance in sensitive cats. How often are you cleaning the boxes? This is huge. Cats are fastidious animals. They don't want to step in urine-soaked litter or dig around old feces. Boxes should be scooped at least once daily, preferably twice. The entire box should be emptied, washed with hot water and mild soap, and refilled with fresh litter at least once a month, more often for small boxes or multiple cats. If your cat is avoiding the box, try scooping after every use for a few days. Yes, it's extreme, but it rules out cleanliness as the issue and often resolves the problem quickly. How deep is the litter? Most cats prefer about 2 to 3 inches of litter. Too shallow and they can't dig and cover properly. Too deep and it feels unstable or wasteful. Now let's talk about location preferences and aversions, because these are common behavioral patterns in litter box problems. A location preference means your cat has decided they like eliminating in a specific spot outside the box. Maybe it's the corner of the basement, the bathroom rug, or a particular patch of carpet. This often develops after a medical issue or a bad experience in the box. The cat pees or poops somewhere else once, it doesn't hurt or isn't scary, and now they prefer that location over the box. Breaking a location preference requires making the preferred location unappealing and making the litter box more appealing. Cover the preferred spot with something your cat won't want to walk on. Aluminum foil, double-sided tape, plastic carpet runners with the nubby side up, or even upside-down laundry baskets can work. Clean the area thoroughly with an enzymatic cleaner designed for pet urine. Regular cleaners don't break down the proteins in urine, so the smell remains detectable to your cat even if you can't smell it. Sometimes you need to block access to the area entirely for a few weeks. Close the door to that room, put furniture over the spot, or otherwise make it impossible for your cat to go there. At the same time, make the litter box situation perfect. Add more boxes. Try different litters. Make sure boxes are scrupulously clean. Put a box very close to the preferred location if possible. Then gradually move it to a more appropriate spot once your cat is using it consistently. A litter aversion is different. This means your cat dislikes something about the litter itself. Maybe the texture bothers their paws. Maybe the scent is overwhelming. Maybe they had one bad experience with that litter and now they associate it with something negative. To diagnose a litter aversion, set up a litter buffet. Put out 3 or 4 boxes right next to each other, each with a different type of litter. Fine clumping clay, non-clumping clay, recycled paper pellets, wood pellets, even plain soil or sand. See which one your cat chooses. That's their preference. Switch to that litter. Box aversion is when your cat dislikes something about the box itself. Maybe it's too small, too covered in a bad location, or associated with a negative experience like being ambushed by another cat or hearing a loud, scary noise while using it. Try setting up new boxes in different locations with different styles. Open boxes, covered boxes, large boxes, boxes with low entry points. See if your cat uses any of the new boxes. If they do, you've identified the problem. If they don't, the issue might be the litter, the location, or something more complex. Multi-cat households have unique litter box challenges. Cats are territorial, and litter boxes are part of that territory. Dominant cats sometimes guard resources, including litter boxes, preventing subordinate cats from using them. If one cat is having accidents in a multi-cat home, watch the dynamics. Is another cat blocking access to the litter box area? Are they sitting nearby staring or chasing the other cat away? This is resource guarding, and it requires more boxes in more locations, so every cat has access to a box they feel safe using. Spread boxes throughout the house, not all in one room. If all 3 boxes are in the basement and one cat guards the basement stairs, the other cats can't reach any boxes. Distribution matters. Some cats won't defecate in a box another cat has urinated in. This is why the 1 per cat plus 1 rule exists. More boxes mean less competition and less territorial conflict. For multi-cat homes with persistent problems, try giving each cat their own designated space with their own box, food, and water. This reduces competition and stress. Now let's talk about urine marking versus inappropriate urination, because these are different behaviors with different causes and different solutions. Inappropriate urination is when your cat squats and empties their bladder somewhere other than the litter box. This is a litter box problem or a medical issue. Urine marking, or spraying, is when your cat backs up to a vertical surface, raises their tail, and sprays a small amount of urine. This is a territorial or stress-related behavior, not a litter box problem. The cat usually still uses the litter box normally for regular urination. Spraying is more common in intact male cats, but neutered males and even females can spray, especially under stress. Common triggers include outdoor cats visible through windows, new pets in the home, changes in routine, moving to a new house, or conflict with other cats in the household. Treating spraying requires addressing the underlying stress. Block your cat's view of outdoor cats. Use pheromone diffusers like Feline to create a calming environment. Increase enrichment and play. Resolve conflicts between household cats. Sometimes anti-anxiety medication is necessary. Clean sprayed areas thoroughly with enzymatic cleaners. Cover vertical surfaces with foil or plastic temporarily to discourage respraying in the same spots. Let's talk about retraining protocols for cats who've developed bad habits. This requires patience and consistency, but it works. Start by confining your cat to a small space, like a bathroom or large kennel, with a pristine litter box, food, water, and a bed. The space should be small enough that the litter box is the obvious choice for elimination. Keep them confined until they're using the box consistently for at least a week. Then gradually expand their access to the house, 1 room at a time. If accidents happen, reduce access again and go back a step. Move slowly. Rushing this process leads to setbacks. During retraining, make previously soiled areas unappealing. Clean thoroughly, use deterrents, and supervise your cat closely when they're in those areas. Interrupt any attempts to eliminate inappropriately with a gentle sound or clap, not punishment. Then immediately redirect to the litter box. Reward litter box use with treats, praise, or play immediately after your cat uses the box. Positive reinforcement builds the right association. Some cats need alternative litter systems. Cats with arthritis or mobility issues might need boxes with very low or even no sides. You can use underbed storage containers, boot trays, or cut an entry point in a standard box. Cats with paw sensitivities might need soft, fine litter, or even alternatives like shredded paper. Some cats with disabilities benefit from larger boxes or boxes with ramps. Top-entry litter boxes work well for some cats and prevent litter tracking, but they're not appropriate for elderly or disabled cats who can't jump. Self-cleaning litter boxes are convenient, but some cats are frightened by the mechanical movements and sounds. If you use one, introduce it gradually with the auto-clean function disabled at first. Litter box furniture that hides the box inside a cabinet looks nice but can trap odors and make some cats feel confined. They work for some cats, but not all. Here's the bottom line on litter box problems. They're solvable. Almost always. But you have to be willing to look at the situation from your cat's perspective, rule out medical issues, adjust the setup to meet their needs, and be patient during retraining. Yes, it's frustrating. Yes, it's exhausting cleaning up accidents and trying different solutions. But punishment doesn't work. Rubbing your cat's nose in it doesn't work. Getting angry doesn't work. What works is systematic troubleshooting, addressing the root cause, and creating a litter box situation that your cat finds acceptable. Your cat wants to use the litter box. They're hardwired to eliminate in loose substrate and cover it. If they're not doing that, something is wrong. Your job is to figure out what that something is and fix it. And with the information in this section, you have the tools to do exactly that. Section 8. Feline anxiety and stress management. Let's talk about something that affects far more cats than most people realize: anxiety and stress. And I'm not talking about the normal stress of a vet visit or the temporary anxiety when you rearrange furniture. I'm talking about chronic, persistent anxiety that affects a cat's quality of life, their behavior, their health, and their relationship with you. Cats are incredibly sensitive creatures. They're hardwired to be vigilant, to notice changes, to respond to potential threats. In the wild, this kept them alive. But in our homes, this same sensitivity can turn normal life into a source of constant stress. And when stress becomes chronic, it manifests as anxiety disorders that need real intervention. We're going to break down the different types of anxiety cats experience, how to recognize them, how to diagnose what's actually going on, what medication options exist, and when they're appropriate, behavioral modification techniques that actually work, environmental changes that reduce anxiety, and real success stories to show you that anxious cats can improve dramatically with the right approach. Let's start by understanding that anxiety in cats isn't one single thing. There are different types of anxiety with different triggers and different presentations. Generalized anxiety is when a cat seems nervous or on edge most of the time, even without obvious triggers. They startle easily, hide frequently, are reluctant to explore or play, and seem hypervigilant. These cats live in a constant state of mild fear. Separation anxiety is when a cat becomes extremely distressed when left alone. They might vocalize excessively, eliminate outside the litter box, become destructive, overgroom, or show signs of panic when you prepare to leave. This isn't the normal "I miss you" that all cats experience. This is genuine distress that affects the cat's well-being. Social anxiety is fear or discomfort around people or other animals. A socially anxious cat might hide when visitors come, show aggression when approached, or be unable to relax in the presence of others. This often stems from inadequate socialization during the critical period we discussed earlier, though it can also develop from negative experiences. Phobias are intense, irrational fears of specific things: thunderstorms, fireworks, vacuum cleaners, car rides. The cat's response is out of proportion to the actual threat. A cat with noise phobia might hide for hours after hearing a loud sound, refuse to eat, or show physical signs of terror like dilated pupils, panting and trembling. Compulsive disorders are anxiety manifesting as repetitive behaviors the cat can't seem to stop. Over-grooming to the point of creating bald patches or sores, pacing the same path over and over, excessive vocalization, tail chasing, or fabric sucking. These behaviors are self-soothing attempts, but they become problematic when they're excessive and interfere with normal life. Redirected aggression happens when a cat is stressed or scared by one thing but can't attack or escape from it. So they redirect their fear and aggression towards something else, often another cat in the household or even their owner. This can create lasting behavioral problems and damage relationships between cats. So how do you know if your cat has an anxiety disorder versus just being a naturally cautious cat? Here are the signs to watch for. Hiding more than usual, especially if your cat used to be social and is now avoiding interaction. Excessive grooming, particularly if it's creating bald spots or skin lesions. Changes in appetite, either eating much less or sometimes eating more as a stress response. Litter box avoidance or changes in elimination patterns often signal stress. Increased aggression, whether toward people or other pets. Excessive vocalization, especially if it's new behavior. Destructive behavior like scratching furniture excessively or chewing on inappropriate objects. Decreased play and activity. Hypervigilance, constantly scanning the environment. Ears twitching, unable to relax. Physical signs include dilated pupils that don't respond normally to light, rapid breathing or panting without physical exertion, excessive shedding, digestive issues like vomiting or diarrhea with no medical cause, and overreaction to normal stimuli like dropping a spoon or closing a door. If you're seeing multiple signs consistently, not just occasionally, it's time to address it. Start with a vet visit to rule out medical causes. Pain, hyperthyroidism, and various other conditions can mimic anxiety. You need to know you're treating the right problem. Once medical issues are ruled out, you can work on anxiety management. For some cats, environmental and behavioral modifications are enough. For others, medication is a necessary tool, at least temporarily, to get the anxiety under control enough that behavioral work can be effective. Let's talk about medication options, because there's often stigma around medicating cats for behavioral issues. But here's the reality. If your cat's anxiety is severe enough that it's affecting their quality of life, medication isn't giving up or taking the easy way out. It's providing relief from suffering and creating a foundation for successful behavioral modification. The most commonly prescribed anti-anxiety medications for cats are selective serotonin reuptake inhibitors, or SSRIs. Fluoxetine, which you might know as Prozac, is frequently used. It increases serotonin levels in the brain, which helps regulate mood and reduce anxiety. It takes several weeks to reach full effect, and it's meant for long-term use in cats with chronic anxiety. Paroxetine and sertraline are other SSRIs sometimes used. They work similarly to fluoxetine, but might have slightly different side effect profiles. Some cats tolerate one better than another. Tricyclic antidepressants like clomipramine and amitriptyline are older medications that also affect serotonin and norepinephrine. They can be effective for anxiety and compulsive disorders, but tend to have more side effects than SSR is. Benzodiazepines like alprazolam or diazepam work quickly to reduce acute anxiety. They're useful for situational anxiety like vet visits, travel, or storms, but they're not ideal for long-term use because they can cause sedation, dependency, and in some cats, paradoxical excitation where they become more agitated instead of calmer. Gabapentin is increasingly popular for situational anxiety. It's not specifically an anti-anxiety drug, but it has calming effects and is very safe. Many vets now recommend giving gabapentin before vet visits or travel to reduce stress. Trazodone is another option that works relatively quickly and can be used for both situational and ongoing anxiety. It causes some sedation, but less than benzodiazepines. Buspirone is an anti-anxiety medication that works differently than SSRIs. It can be helpful for cats with urine marking or intercat aggression related to anxiety. The key with medication is that it's not a cure. It's a tool that reduces anxiety enough that behavioral modification can work. A cat who's so anxious they can't function can't learn new coping strategies. Medication brings anxiety down to a manageable level, then you work on the underlying issues through behavior modification and environmental changes. Side effects are usually mild but can include lethargy, changes in appetite, and digestive upset. Most side effects improve after the first week or two as the cat adjusts. If side effects are severe or persistent, the dose can be adjusted or a different medication tried. Never start or stop anxiety medication without veterinary guidance. These medications need to be introduced gradually and discontinued slowly to avoid problems. Now let's talk about behavioral modification, because this is where the real work happens. The goal is to change how your cat responds to triggers and build their confidence so they can cope with normal life without constant fear. Desensitization is the process of gradually exposing your cat to a fear trigger at a low enough intensity that they don't react, then very slowly increasing the intensity over time. For example, if your cat is terrified of the vacuum cleaner, you start by just having the vacuum in the room while your cat is eating or playing. Not running it, just present. Once your cat is comfortable with that, maybe you move it slightly. Then you turn it on in another room with the door closed. Gradually, over weeks or even months, you work up to running it in the same room while your cat remains calm. The key is never pushing too fast. If your cat shows fear at any stage, you've moved too quickly and need to go back to the previous level. You want to stay just below the threshold where fear kicks in, building positive associations at each level. Counter-conditioning pairs the fear trigger with something positive. Every time the scary thing appears, something amazing happens. If your cat is afraid of strangers, every time a visitor arrives, your cat gets high-value treats, their favorite toy, or playtime. Over time, the cat starts to associate visitors with good things rather than fear. This works best when combined with desensitization. Start with the trigger at low intensity, pair it with rewards. Gradually increase intensity while maintaining the positive association. Here's a real example. Let's say your cat has storm phobia. Desensitization might involve playing recordings of storm sounds at very low volume while your cat eats. Counter-conditioning adds high-value treats or play during the sounds. Gradually increase the volume over weeks. The goal is for your cat to eventually hear real storm sounds and feel calm or even positive, because storms predict treats. Confidence building through environmental enrichment helps anxious cats feel more secure. Provide vertical space like cat trees and wall-mounted shelves where your cat can observe from height. Cats feel safer when they can survey their territory from above. Create hiding spots and safe zones where your cat can retreat when overwhelmed. Covered beds, boxes, or even a quiet room where they're never disturbed. These aren't enabling fear. They're providing necessary security. Increase predictability through routine. Feed at the same times. Play at the same times. Keep furniture arrangements stable. Anxious cats find comfort in knowing what to expect. Provide appropriate outlets for natural behaviors, scratching posts, hunting games with food puzzles, opportunities to climb and explore. A mentally and physically stimulated cat is less likely to develop anxiety-related behaviors. Pheromone therapy can be surprisingly helpful. Feline is a synthetic version of feline facial pheromones. It creates a sense of familiarity and security. It comes as plug-in diffusers, sprays, or collars. It's not magic, but many cats show reduced anxiety when it's used consistently, especially in combination with other interventions. For multi-cat household anxiety, proper resource distribution is critical. Multiple litter boxes, feeding stations, water sources, and resting areas spread throughout the house reduce competition and territorial stress. Make sure cats aren't forced to interact to access necessities. Calming supplements like L-theanine, tryptophan, or casein hydrolysate might help some cats. The evidence is mixed, but they're generally safe, and some cats respond well. Products like Zilkine or Soliquin are worth trying for mild to moderate anxiety. Let's talk about some specific scenarios and how to address them. A cat with separation anxiety needs a gradual desensitization protocol. Start by leaving for just 30 seconds. Come back before your cat shows anxiety. Reward calm behavior. Gradually increase duration. Leave for 1 minute, 2 minutes, 5 minutes. The increases should be tiny, and the process takes weeks. Create positive associations with your departure cues. If picking up your keys predicts you leaving and triggers anxiety, pick up your keys randomly throughout the day when you're not leaving. Put them down. Repeat until your cat no longer reacts to the keys. Provide enrichment while you're gone. Food puzzles, window access with bird feeders outside, calming music. Keep arrivals and departures low-key. Don't make a big emotional production of leaving or returning. Be casual. For a cat who's aggressive toward other cats due to anxiety, you might need a complete reintroduction protocol. Separate the cats completely. Feed them on opposite sides of a closed door so they associate each other with food. Gradually create positive associations through scent swapping, visual access through baby gates, and supervised interactions with high-value rewards. This process can take weeks or months. You're essentially starting over and building a relationship from scratch, but this time doing it right with anxiety management in place. For noise phobias, create a safe room where your cat can go during storms or fireworks. Play white noise or calming music to muffle the sounds. Use pheromone diffusers. Consider anxiety medication for severe cases. Provide distractions like food puzzles or interactive toys. Never force your cat out of hiding or try to prove there's nothing to fear. Let them cope in their own way. For compulsive disorders like over-grooming, medication is often necessary to break the cycle. Combine it with environmental enrichment, stress reduction, and addressing any triggers. Sometimes, even after the behavior stops, the cat needs to stay on medication long-term to prevent relapse. Here's a success story to give you hope. I know of a cat named Luna who was so anxious she spent 23 hours a day hiding under a bed. She wouldn't eat unless her owner left the room. She never played, never purred, never interacted. She'd been like this for 2 years after being adopted from a shelter. Her owner worked with a veterinary behaviorist. Luna was started on fluoxetine. Feline diffusers were placed throughout the house. A strict routine was established. Food puzzles were introduced to encourage exploration. The owner spent time every day sitting near Luna's hiding spot, not interacting, just being present and reading aloud so Luna got used to her presence. After 6 weeks, Luna started coming out briefly when her owner was in the room. After 3 months, she was eating with her owner present. After 6 months, she initiated play for the first time. After a year, she was a different cat. Still cautious, still not a social butterfly, but she played daily, slept on the bed, greeted her owner at the door, and clearly enjoyed life. She stayed on fluoxetine long-term, and that's okay. It gave her the ability to function and experience positive emotions. Without it, she was trapped in fear. With it, she could finally be a cat. Not every case is that dramatic, and not every cat needs medication. But the point is that anxiety is treatable. It requires patience, consistency, and often professional help, but anxious cats can improve. They can learn to feel safe, to relax, to enjoy life. If your cat is suffering from anxiety, don't just accept it as their personality. Get help. Talk to your vet. Consider a consultation with a veterinary behaviorist. Implement environmental changes. Try medication if recommended. Work through behavioral protocols. Your cat doesn't have to live in fear. Anxiety is suffering, and it's treatable suffering. With the right approach, most anxious cats can experience significant improvement and finally have the quality of life they deserve. Section 9. Advanced Multi-Cat Household Management. Let's talk about something that sounds simple, but is actually incredibly complex: living with multiple cats. A lot of people think that because cats are independent, you can just add another cat to your home and they'll figure it out. And sometimes that works, but more often, it doesn't. Multi-cat households have unique dynamics, power structures, territorial conflicts, and resource competition that single-cat homes never face. We're going to dive deep into how cats actually view territory and social structure, how to properly map territory in a multi-cat home, solving resource competition problems, the right way to introduce cats to each other, managing hierarchies and social dynamics, preventing and breaking up fights, and addressing the common behavioral problems that emerge when cats don't get along. First, let's understand how cats think about territory, because this is fundamental to everything else. Cats are not pack animals. They don't have the same social structure as dogs. In the wild, cats are solitary hunters who maintain individual territories. Female cats sometimes form loose colonies with related females, sharing territory, and even helping raise kittens together. But males are generally solitary, except during mating. Domestic cats have adapted to living in groups, but their fundamental territorial instinct remains. Every cat in your home has a mental map of their territory. And here's the important part. Cats don't necessarily view territory the same way we do. We think of the whole house as shared space. Cats think in terms of core territory, home range, and buffer zones. Core territory is where a cat feels completely safe. This might be a specific room, a particular piece of furniture, or even just a high perch. This is where they sleep deeply, eat, and relax fully. Cats will defend core territory aggressively if another cat invades it. Home range is the larger area a cat patrols and uses regularly but doesn't necessarily defend. In your house, this might be most of the living space. Cats tolerate other cats in their home range, but monitor them carefully. Buffer zones are areas between territories or along the edges where cats might encounter each other. These are often flashpoints for conflict if cats haven't established clear boundaries and social rules. Now here's where it gets complicated. In a multi-cat household, these territories overlap extensively. You can't give each cat their own separate house. They have to share space. Whether this works peacefully depends on several factors. How many resources are available, how those resources are distributed, whether the cats have compatible personalities, whether they were introduced properly, and whether there's enough space for each cat to have some territory they can call their own. Let's talk about territory mapping, because this is a diagnostic tool that can reveal why your cats aren't getting along. Spend several days observing where each cat spends their time. Track which cat uses which sleeping spots, which cat accesses the window perches, who eats from which bowls, who uses which litter boxes. You'll often see patterns. One cat might dominate the entire second floor. Another might stick to the basement. A third might only feel safe in the bedroom. Sometimes you'll see time sharing, where one cat uses the living room in the morning and another uses it at night, avoiding each other entirely. You'll also see blocking behavior. One cat sits in a doorway or at the top of stairs, not doing anything obviously aggressive, but their presence prevents another cat from accessing that area. This is passive territorial control, and it's incredibly common in multi-cat homes. Once you map the territories, you can identify problems. Is one cat being shut out of most of the house? Is another cat resource guarding critical areas, like the litter box room or the kitchen? Are there pinch points where cats frequently have tense encounters because there's no way to avoid each other? Resource distribution is the next critical factor. Cats compete for resources: food, water, litter boxes, sleeping spots, access to you, toys, and vertical space. If resources are limited or poorly distributed, conflict increases. The litter box rule we mentioned before, 1 per cat plus 1, exists because cats often won't share boxes. Defecation especially is territorial. A cat who poops in a box is making a statement about ownership. Other cats might avoid that box, or if they're dominant, might deliberately eliminate in it to assert dominance. But it's not just about number of boxes. Distribution matters. If all 3 boxes are in one room, a dominant cat can guard that room and effectively control all the boxes. Boxes need to be spread throughout the house in different locations, so every cat has access to a box they can reach without encountering another cat. The same goes for food and water. Feeding all cats in one location creates competition. Some cats eat faster because they're anxious about another cat stealing their food. Others don't get enough because a dominant cat chases them away. Feed cats in separate locations, ideally in different rooms, so each cat can eat peacefully. Water sources should also be distributed. Multiple water bowls or fountains in different areas mean cats aren't competing for hydration. Some cats won't drink from a bowl, another cat just used. Sleeping spots and vertical territory are often overlooked resources, but they're crucial. Cats need multiple resting spots throughout the house at different heights. A cat tree with 3 perches doesn't give 3 cats equal access because only one cat can claim the top perch, which is usually the most desirable. Provide multiple cat trees, wall-mounted shelves, window perches, and hiding spots. The more options, the less competition. A good rule of thumb is to provide at least twice as many resting spots as you have cats, distributed throughout the house at various heights. Now let's talk about introducing cats properly, because this is where most multi-cat household problems begin. People bring a new cat home, put them in a room with the resident cat, and hope they'll become friends. And when they don't, when they fight or hiss or hide, the owner doesn't know how to fix it. Here's the protocol that actually works. It's slow, it's tedious, and it requires patience, but it prevents aggression, builds positive associations, and gives cats time to adjust to each other's presence without feeling threatened. Step 1. Complete separation. The new cat goes in a separate room with their own food, water, litter, and bed. No visual contact with resident cats, no physical contact, just scent. Leave the new cat in that room for at least a few days so they can adjust to the new environment without the stress of meeting other cats. During this time, the cats can smell each other under the door. This is the first stage of introduction, scent familiarization. You can accelerate this by scent swapping. Rub a towel on one cat, especially around their cheeks where scent glands are located, and leave it with the other cat. Switch their bedding so they sleep on fabric that smells like the other cat. Step 2. Feed on opposite sides of a closed door. Set up feeding stations right at the door, one cat on each side. Start with the bowls far enough from the door that neither cat is stressed. They eat, they smell the other cat through the door, they leave. This creates a positive association. Other cats' scent predicts food. Gradually, over days or weeks, move the bowls closer to the door. The goal is for both cats to eat comfortably right at the door, separated only by that barrier. This means they associate each other's presence with something positive. Step 3. Visual access without physical contact. Use a baby gate or crack the door just enough that cats can see each other but can't interact physically. Continue feeding on opposite sides. The cats can now see each other while eating. If either cat shows stress, hisses, or refuses to eat, you've moved too fast. Go back to feeding with the door closed and try again in a few days. Step 4. Supervised interaction in neutral territory. Once both cats are calm with visual access, you can allow them in the same room together under close supervision. Choose a large room, not the resident cat's core territory. Provide escape routes for both cats. Have treats or toys ready to create positive distractions. Keep sessions short, maybe 5 to 10 minutes at first. Watch body language carefully. Tense posture, flattened ears, dilated pupils, tail lashing, or stalking behavior means the cats aren't ready. Separate them and go back to the previous step. If both cats are calm, even if they're ignoring each other, that's success. Reward calm behavior with treats. End the session on a positive note before either cat gets stressed. Step 5. Gradually increase interaction time. Over weeks, extend the supervised sessions. Eventually, you can leave them together unsupervised for short periods, then longer periods, until they're fully integrated. This entire process can take weeks or even months. Rushing it creates conflict that can last for years. Doing it slowly builds a foundation for peaceful coexistence. What if you didn't do this and now your cats hate each other? You might need a complete reintroduction. Separate them completely as if they've never met. Follow the protocol from the beginning. It feels like going backward, but it works. You're essentially resetting their relationship and starting fresh, this time doing it right. Let's talk about cat hierarchies, because understanding social structure helps you manage dynamics. Contrary to popular belief, cat social hierarchies aren't strictly linear. It's not a simple alpha, beta, omega structure like you might see in dogs or wolves. Cat hierarchies are more fluid and situational. One cat might have priority access to food. A different cat might control the best sleeping spots. A third might be the boldest with humans but submissive to other cats. Dominance can shift depending on context, location, and what resource is being contested. Some cats are clearly more confident and assertive across all contexts. These cats claim the best spots, eat first, and rarely back down from confrontations. Others are consistently more submissive, deferring to other cats and avoiding conflict. Problems arise when the hierarchy is unstable or when a cat can't accept their position and constantly challenges other cats, or when a highly dominant cat bullies others to the point where subordinate cats are afraid to access basic resources. Your role isn't to enforce a hierarchy or choose which cat should be dominant. It's to ensure that all cats, regardless of social position, have access to necessary resources. A subordinate cat should still be able to eat, drink, use the litter box, and sleep comfortably. If one cat is preventing that through guarding or bullying, you need to intervene. How? By changing the environment so the dominant cat can't control everything. More resources in more locations means they can't guard them all. Providing escape routes and vertical space means subordinate cats can avoid confrontation. Feeding in separate rooms means the dominant cat can't monitor others while they eat. Sometimes you need to actively disrupt bullying behavior. If you see one cat stalking or blocking another, interrupt with a distraction. Toss a toy, make a noise, create a diversion. Don't punish the dominant cat, just break the pattern. Let's talk about cat fights and how to handle them. First, distinguish between play fighting and real aggression. Play fighting is usually silent. Neither cat seems genuinely distressed. They take turns being on top and they go back to normal behavior immediately afterward. Real fighting involves growling, screaming, fur flying, one cat clearly trying to escape, and often injuries. If a real fight breaks out, don't get in the middle of it. You will get hurt. Instead, make a loud noise. Clap, yell, drop something heavy on the floor. Many fights break up when cats are startled. You can also try spraying water, throwing a blanket over the cats to separate them, or using a broom or cushion to physically separate them without using your hands. Once separated, isolate the cats in different rooms. Don't try to comfort them immediately. They're in fight or flight mode and might redirect aggression toward you. Give them time to calm down, at least an hour. After a serious fight, you might need to treat it like a fresh introduction. Separate the cats, go back to scent swapping and feeding on opposite sides of a door. Rebuild the relationship slowly. Redirected aggression is a specific phenomenon that happens in multi-cat homes. One cat sees something threatening, often an outdoor cat through a window, and becomes aroused and agitated. Another cat approaches, and the aroused cat attacks them even though they're not the source of the fear. This can create lasting problems because the attacked cat now fears the aggressor, and the aggressor might have learned to associate the other cat with their aroused state. Managing this requires separating the cats, blocking visual access to the trigger, and doing a slow reintroduction. Let's talk about specific multi-cat problems and solutions. Problem: one cat is over-grooming another cat, creating bald spots. This is often dominance-related grooming. The groomer is asserting control. Solution: provide more environmental enrichment for the groomer to redirect the behavior. Interrupt excessive grooming sessions. Ensure the groomed cat has safe spaces to escape to. Problem: cats play too roughly and one is getting hurt or stressed. Solution: ensure the rougher player has adequate play opportunities with toys to burn energy. Provide high places where the more delicate cat can retreat. Interrupt play before it escalates to actual aggression. Problem: one cat eats all the food and the other is losing weight. Solution: feed in separate rooms with the door closed. Consider timed feeders that only one cat can access, using microchip recognition. Feed smaller meals more frequently so the food-motivated cat can't gorge. Problem: one cat guards the litter box and another is eliminating elsewhere. Solution: add more boxes in more locations. Place boxes where the guarding cat can't see them all simultaneously. Create multiple entry points to the box area so the guarded cat has alternative routes. Problem: cats were fine for years, then suddenly started fighting. This often indicates a medical issue. Pain makes cats irritable and more likely to lash out. A cat with hyperthyroidism, dental pain, arthritis, or declining cognitive function might suddenly become aggressive. Solution: vet check for both cats. Once medical issues are addressed, behavioral issues often improve. Here's a success story. A household with 4 cats had chronic fighting between 2 of them. The owner couldn't identify triggers. The fights were sudden and severe. Territory mapping revealed that one cat controlled access to the second floor by sitting at the top of the stairs. The other cat, who wanted to sleep upstairs, would try to pass and get attacked. Solution: a second staircase access point was created using cat shelves along the wall, allowing the blocked cat to reach the second floor without passing the garter. Feeding stations were moved to separate rooms. Extra litter boxes were added. Within 2 weeks, fighting stopped. The cats established separate territories with minimal overlap, and peace was restored. The key insight: sometimes cats don't need to be friends. They just need to coexist without constant conflict. Giving them the space and resources to avoid each other when they want to is often more effective than forcing interaction. Multi-cat households can be wonderfully enriching for both cats and humans. Cats can provide companionship for each other, engage in play, and create a dynamic household, but it requires thoughtful management. You need enough space, enough resources, proper introductions, and ongoing monitoring of dynamics. If you're considering adding another cat, think carefully about whether your current cat would benefit or whether they prefer being an only cat. Some cats crave feline companionship, others are happier alone. Respect your cat's personality and preferences. If you already have multiple cats who aren't getting along, don't accept chronic conflict as normal. Cats who are constantly stressed by other cats in the household are suffering. They deserve intervention. Work through reintroductions, adjust resources, consult with a behaviorist if needed, and create an environment where all cats can thrive. Living with multiple cats successfully isn't about luck. It's about understanding feline social behavior, providing appropriate resources, managing territory, and responding to problems before they become entrenched. With the right approach, even cats who start off hostile can learn to share space peacefully. It takes effort, but peaceful multi-cat households are absolutely achievable. Section 10. Cat Communication, Advanced Body Language. Let's talk about something that separates people who live with cats from people who truly understand cats: the ability to read feline body language. Most cat owners can recognize the obvious signals. Hissing means angry, purring means happy, tail up means friendly. But cat communication is far more nuanced than that. Cats are constantly broadcasting information about their emotional state, their intentions, and their comfort level. And most of it is subtle, easily missed, and often misinterpreted. We're going to break down the complete vocabulary of cat body language, the micro expressions that last only a fraction of a second, the 50+ different tail positions and what each one means, ear positions that reveal emotional states, whisker reading, eye communication including pupil dilation and blinking patterns, the 20+ distinct vocalizations cats make and what each one communicates, and how to read all these signals together, because cats don't communicate with just one body part. They use their entire body as a language. Let's start with the tail, because it's one of the most expressive parts of a cat's body and one of the easiest to misread. A tail held high and vertical, maybe with a slight curve at the tip like a question mark, is a confident, friendly greeting. This is a cat who's happy to see you, feels secure, and is approaching with positive intent. It's the feline equivalent of a smile and a wave. But change that position slightly and the meaning changes. A tail held high but with the fur fluffed up, making it look like a bottle brush, signals fear or aggression. The cat is trying to look bigger to intimidate a threat or defend themselves. This is a cat on high alert, not a happy cat. A tail straight up but vibrating or quivering usually means excitement. Cats often do this when they're about to be fed or when greeting a favorite person. Some intact male cats also do this when marking territory with urine, so context matters. A tail held low, close to or tucked between the legs, signals fear, submission, or uncertainty. A cat walking with their tail tucked is trying to appear small and non-threatening. They're either scared or submitting to a more dominant cat or person. A tail held horizontal, straight out behind the body, is neutral. The cat is alert and paying attention, but not particularly emotional about what's happening. This is a baseline position that can shift quickly based on what the cat perceives. Now let's talk about tail movement, because motion adds layers of meaning. A slowly swaying tail moving back and forth in a relaxed rhythm often means the cat is focused on something interesting. They might be watching a bird, stalking a toy, or contemplating whether to jump somewhere. The swaying helps them gauge distance and prepare for movement. A tail thrashing or thumping hard from side to side signals annoyance, frustration, or overstimulation. This is a warning. A cat doing this is saying they're getting irritated and you should back off. If you're petting a cat and their tail starts thumping, stop immediately before they escalate to biting or swatting. Rapid tail flicking, where just the tip of the tail is moving quickly, indicates focused attention, mixed with irritation or excitement. A cat watching prey might do this, or a cat who's being petted and is getting close to their tolerance threshold. A tail curled around the body while the cat is sitting or lying down usually means contentment and relaxation. It's a self-comforting position, but if the tail is wrapped tightly and the cat's body is tense, it might indicate they're cold or anxious. When a cat wraps their tail around another cat or around your leg, it's an affiliative behavior, a sign of bonding and affection. It's the cat version of putting an arm around someone. Here's one most people don't know. A tail position straight down with a slight bend or hook at the very tip can indicate uncertainty or mild concern. The cat isn't scared enough to tuck the tail completely, but they're not confident either. A tail held to one side while the cat is walking signals that the cat is being submissive or trying to avoid confrontation with another cat they're passing. It's a deferential posture. Now let's move to ears, because ear position is incredibly revealing. Ears facing forward and slightly to the side is the neutral, relaxed position. The cat is alert but calm, paying casual attention to their environment. Ears pricked straight up and rotated fully forward indicate intense focus. The cat has heard or seen something interesting and is directing all their attention toward it. This is curiosity, not fear. Ears flatten to the sides, often called airplane ears because they stick out horizontally, signal anxiety, fear, or defensive aggression. The cat is saying they're uncomfortable and might defend themselves if pushed. The more flattened the ears, the more stressed the cat. Ears flattened completely backward against the head indicate extreme fear or offensive aggression. This is a cat who is either terrified and might attack out of panic or is preparing to fight aggressively. This ear position, combined with other aggressive signals like dilated pupils and an arched back, means serious danger. Ears that are rotating independently, swiveling in different directions, mean the cat is monitoring multiple things simultaneously. They might have one ear listening to you and one ear tracking something else in the environment. It shows active environmental scanning. Here's a subtle one. When a cat's ears are in neutral position, but they flick backward briefly, it often means mild annoyance or a startle response to a sudden sound. If you're petting a cat and their ears flick back for just a moment, you might have touched a sensitive spot. Now, whiskers, which most people completely ignore but are actually incredibly expressive. Whiskers fanned out, forward and slightly spread, indicate interest and friendly curiosity. A cat investigating something new has their whiskers positioned forward to gather tactile information. Whiskers pushed forward and bunched together signal aggression or intense focus on prey. A cat in hunting mode or about to attack will have their whiskers pointed forward and tight together. Whiskers pulled back flat against the face indicate fear or submission. A scared cat pulls their whiskers back to make themselves seem smaller and less threatening. Relaxed whiskers, in a neutral position neither forward nor back, mean the cat is calm and content. This is the baseline whisker position for a happy cat at rest. Eyes and pupils are next. Cats communicate a lot with their eyes, but it's not always intuitive. Slow blinking, where a cat looks at you and slowly closes and opens their eyes, is a sign of trust and affection. It's often called a cat kiss. If you slow blink at your cat and they slow blink back, you've just exchanged affectionate greetings. Direct, unblinking staring, especially with dilated pupils, is a threat or challenge. Cats don't stare at each other in friendly situations. A stare is confrontational. This is why cats often dislike when strangers stare at them. Half-closed eyes, sometimes called sleepy eyes, indicate relaxation and contentment. A cat lounging with half-closed eyes is comfortable and at ease. Wide-open eyes with normal-sized pupils suggest alertness and interest. The cat is paying attention but not afraid or aggressive. Now, pupil dilation is where things get really interesting. Pupils dilate for several reasons: low light, fear, excitement, and pain. You have to read pupil dilation in context. Dilated pupils in bright light usually mean fear or excitement. Constricted pupils in dim light might indicate pain or a neurological issue. Pupils that dilate suddenly during petting can mean the cat is becoming overstimulated and might bite or scratch. It's a warning sign that arousal is increasing. Pupils dilating when another cat approaches might indicate fear or the preparation to fight or flee. Combined with other body language, you can determine which. Let's talk about overall body posture because individual signals combine to create a complete picture. A relaxed cat has loose body language. Their muscles aren't tense. They might roll over, exposing their belly. They lie in sprawled, comfortable positions. Their movements are fluid and unhurried. A tense cat has stiff body language. Muscles are tight. The cat might crouch low to the ground or stand very still. Movements are either frozen or very deliberate. This indicates stress, fear, or preparation for action. An arched back with piloerection, where all the fur stands on end, is the classic Halloween cat posture. This is defensive fear. The cat is trying to look as large and intimidating as possible to scare off a threat. Despite the scary appearance, this is usually a frightened cat, not a confident aggressor. A low crouch with the body pressed to the ground, ears back and eyes wide means extreme fear. This cat is trying to make themselves as small as possible. They might be about to flee or, if cornered, might panic and attack defensively. A body leaning forward with weight on the front legs, ears forward, and pupils dilated indicates offensive aggression or intense prey focus. This is a cat preparing to pounce, whether at prey or in a fight. A cat rolling over and exposing their belly might be showing trust and comfort, or it might be a defensive posture, preparing to use all 4 sets of claws if attacked. Context is everything. A cat who rolls over in front of you and has relaxed body language is showing trust. A cat who rolls over during a fight is preparing to defend with all available weapons. Now let's talk about vocalizations, because cats have a much larger vocabulary than most people realize. The standard meow is the baseline, but there are dozens of variations. A short single meow is often a greeting or acknowledgement. Hello or I see you. Multiple meows in a row, becoming more insistent, usually means a demand. Feed me or let me out or pay attention to me now. A high-pitched, short meow can indicate surprise or sudden need. A low-pitched, drawn-out meow often signals complaint or displeasure. Chirping or chattering, that rapid clicking sound cats make when watching birds, is believed to be either frustration at not being able to reach prey or possibly a hunting technique where the cat mimics bird sounds. The exact reason isn't fully understood, but it's associated with predatory excitement. Trilling is a rolling, musical sound that mother cats use with kittens. Adult cats often trill at humans as a friendly, positive greeting. It's warmer and more affectionate than a standard meow. Purring usually indicates contentment, but cats also purr when frightened, injured, or giving birth. The frequency of purring, around 25 to 150 Hz, has been shown to promote healing and relieve pain, so purring might be a self-soothing mechanism. Context tells you whether a purring cat is happy or stressed. Growling is a clear warning. Back off. A growling cat is prepared to defend themselves and is giving you a chance to retreat before they escalate. Hissing and spitting are defensive threats. The cat is scared and warning you that they will fight if you come closer. This is fear-based aggression, not confident aggression. Yowling. a long, loud, drawn-out vocalization, has several meanings. Intact cats in heat yowl to attract mates. Cats in pain might yowl. Elderly cats with cognitive dysfunction often yowl at night, seemingly for no reason. Cats fighting or about to fight sometimes yowl. Caterwauling is an extended, warbling yowl, most common in intact cats, but also heard in fights or territorial disputes. Silent meowing, where a cat opens their mouth in a meow shape but makes no sound or only a tiny squeak, is often directed at humans the cat is very bonded with. It's an intimate, affectionate communication. Chirruping, a short, high-pitched trill, is what mother cats use to call kittens. Some cats use it with humans they're very bonded to, essentially treating you like a kitten. Moaning or mumbling, low vocalizations that aren't quite meows, often occur when a cat is dreaming, especially if they're twitching or moving their paws. They're probably experiencing REM sleep and vocalizing about whatever they're dreaming. Huffing, a sharp exhale through the nose, can indicate mild annoyance or exertion, like when jumping to a high place. Here's where reading cat communication gets advanced, combining signals. A cat with ears forward, tail up, slow blinking and soft chirping is extremely happy and affectionate. A cat with ears back, tail thrashing, dilated pupils, and a low growl is warning you off. But subtle combinations are where most people miss the signals. A cat who's being petted and seems relaxed, then their tail starts twitching slightly, their ears flick back briefly, and their pupils dilate a bit, is showing early signs of overstimulation. If you don't stop, the next signs will be more obvious: faster tail thumping, tense body, maybe a warning nip. But the cat gave you earlier, subtler warnings that you missed. A cat with slightly flattened ears, a low tail, slow movements, and avoiding eye contact isn't necessarily scared. They might be feeling submissive or uncertain, but not terrified. Compare this to a cat with ears completely flat, tail tucked, body pressed to the ground, and frozen movement. That cat is genuinely terrified. Context changes meaning. A cat with dilated pupils, tail up, and forward ears might be in predatory play mode, excited and happy. The same physical signals in a different context, like when approached by a stranger, might indicate fear and preparation to flee. One of the most commonly misunderstood signals is belly exposure. People see a cat roll over and show their belly and think it's an invitation to rub the belly. Then they get scratched and think the cat was being mean. But belly exposure in cats isn't necessarily an invitation to touch. It's often a sign of trust, the cat showing they're comfortable enough to be vulnerable. But many cats don't like their bellies touched. It's a sensitive area with vital organs, and touching it can trigger a defensive reaction even in a relaxed cat. Read the whole picture. Is the cat's body language loose and relaxed? Are they purring? Do they lean into your touch when you pet their head? Then maybe they'll tolerate gentle belly rubs. Are they lying still with tense muscles? Are their ears slightly back? Is their tail twitching? Then the belly exposure is comfort, not invitation, and touching it will get you bitten. Let's talk about stress signals that are easily missed. A cat licking their lips or nose repeatedly when there's no food around is a stress signal. Excessive yawning, not the normal waking up yawn but repeated yawning, indicates anxiety. Frequent self-grooming, especially of the same spot over and over, is a displacement behavior that cats do when stressed. A cat who's sitting still and appears calm but has tense muscles, slightly dilated pupils, and is scanning the environment constantly is actually on high alert, not relaxed. True relaxation includes loose muscles, comfortable positions, and not being hypervigilant. Freezing behavior, where a cat suddenly goes completely still, is often misread as calm, but it's actually a fear or stress response. The cat has seen or heard something they perceive as threatening and is trying to avoid detection or decide whether to flee. Piloerection in just the tail or just along the spine, not the full-body Halloween cat puff, indicates moderate fear or excitement. A cat who's startled might fluff just their tail. A cat in a moderately stressful situation might have a line of raised fur along their spine. Now let's talk about common misinterpretations. People often think a cat purring and kneading on them means the cat is happy, which is usually true. But if the kneading is intense, claws fully extended and digging in, and the cat's pupils are dilated, this might be overstimulation, not pure contentment. The cat is in a high arousal state and might bite suddenly. People think a cat rubbing against their legs is always affection, and it often is, but it's also scent marking, claiming ownership. The cat is saying, mine. It's usually positive, but it's also territorial. People think a cat showing their belly wants it rubbed. We've covered this. It's trust, not always invitation. People think a cat who brings them dead prey is being sweet and sharing. Actually, the cat might be teaching you to hunt or bringing food to the colony, yes. But they might also be showing dominance or simply exhibiting natural instinctual behavior without emotional intent toward you. Here's one that surprises people. A cat who headbutts you or rubs their face on you isn't just being affectionate. They're marking you with scent glands located on their cheeks and forehead. It's affection, but it's also claiming you as part of their territory. You belong to me. Learning to read cat body language fluently takes time and observation. You need to watch your individual cat because while there are universal signals, individual cats have their own communication styles. Some cats are more vocal than others. Some have dramatic body language, and others are subtle. Pay attention to your cat's baseline. What does their normal, relaxed state look like? What are their default ear position, tail position, and activity level? Once you know their baseline, deviations become obvious. A normally active cat who's suddenly quiet and still might be feeling unwell. A normally cuddly cat who starts avoiding contact might be in pain or stressed. Context is everything. The same signal can mean different things in different situations. A dilated pupil when seeing a favorite toy means excitement. A dilated pupil when confronted by another cat means fear or preparation to fight. You can't read signals in isolation. And remember, cats give warnings before they escalate. A bite or scratch doesn't come out of nowhere. There were signals you missed. The more fluent you become in reading body language, the better you can respond to your cat's needs before situations escalate. If you can read your cat accurately, you'll know when they're relaxed, when they're anxious, when they're overstimulated, when they're in pain, when they're happy, and when they need space. This understanding transforms your relationship. You stop misinterpreting their signals. You stop accidentally stressing them or pushing past their boundaries. And you start communicating with them in a language they actually understand. Your cat is talking to you constantly. Every ear flick, every tail twitch, every pupil dilation is communication. The question is whether you're listening. Section 11, Indoor Cat Enrichment. Complete Guide. Let's talk about something that can make the difference between a cat who's merely surviving indoors and a cat who's truly thriving, environmental enrichment. And I'm not talking about buying a few toys and calling it done. We're going deep into the science of enrichment, why indoor cats need it so desperately, what happens when they don't get it, and how to create an environment that meets all of a cat's instinctual needs even though they're living in a house instead of hunting in the wild. Indoor cats live longer, safer lives than outdoor cats. They're not exposed to cars, predators, diseases, or fights with other animals. But there's a trade-off. Indoor cats often suffer from chronic boredom, lack of stimulation, obesity, behavioral problems, and what behaviorists call learned helplessness, where the cat stops trying to engage with their environment because nothing interesting ever happens. A cat's brain and body are designed for hunting, exploring, climbing, solving problems, and engaging with a complex, changing environment. When we keep them inside without providing alternatives to these natural behaviors, we're essentially asking them to exist in sensory deprivation. And that has real consequences: depression, anxiety, aggression, destructive behavior, overeating, and obsessive-compulsive disorders. So enrichment isn't optional. It's not a luxury. It's a fundamental need, as important as food and water for your cat's psychological well-being. Let's break down what enrichment actually means and how to provide it comprehensively. Enrichment falls into several categories: environmental, sensory, feeding, social, and cognitive. A well-enriched cat has access to all of these types regularly. Environmental enrichment means creating a physically complex space that allows natural behaviors. In the wild, cats move through three-dimensional territory. They climb trees, hide in bushes, perch on rocks, and navigate varied terrain. Indoor cats need the same complexity, just adapted to a house. Vertical space is absolutely critical. Cats feel safer when they can observe from height. It gives them a vantage point to monitor their territory and provides escape routes from ground-level threats, whether that's a dog, a child, or just another cat they're not getting along with. Install cat shelves on walls at varying heights, creating highways that let your cat move around the room without touching the floor. These don't need to be expensive. A few sturdy shelves from a hardware store, mounted securely, work perfectly. Arrange them so your cat can jump from one to another, creating vertical pathways. Cat trees are another option, but choose wisely. Most commercial cat trees are too small, too flimsy, or covered in carpet that snags claws. Look for tall, sturdy trees with multiple levels, ideally reaching close to the ceiling. Solid wood construction is better than particle board. Sisal rope for scratching surfaces, not carpet. Window perches give cats access to the most enriching thing many indoor cats ever experience: watching the outside world. Birds, squirrels, leaves blowing, people walking by. This is endless entertainment. Mount perches at window height or provide furniture your cat can use to access windows. Some cats will spend hours just watching. Hiding spots in enclosed spaces meet a cat's need for security. Boxes, cat tunnels, covered beds, or even furniture arranged to create cave-like spaces give your cat places to retreat when they want privacy or feel overwhelmed. Don't think of this as encouraging fear. It's providing necessary resources for emotional regulation. Scratching posts and surfaces need to be available in multiple locations and orientations. Some cats prefer vertical scratching, others horizontal, and some like angled surfaces. Provide options. Make sure posts are tall enough for your cat to fully stretch, sturdy enough they don't wobble, and covered in materials your cat likes. Most prefer sisal rope or corrugated cardboard over carpet. Now let's talk about sensory enrichment, engaging your cat's senses of sight, sound, smell, and touch. Visual enrichment is what we touched on with window access, but you can enhance it. Bird feeders outside windows attract wildlife for your cat to watch. Some people set up fish tanks as cat TV, though make sure the tank is secure and your cat can't knock it over or stress the fish. Videos designed for cats, showing birds, squirrels, or fish, can provide visual stimulation when you're away. Some cats love them, others ignore them. Try it and see if your cat responds. Auditory enrichment includes playing music or ambient sounds. Some cats enjoy soft classical music or nature sounds. There's even music composed specifically for cats, using frequencies and tempos that appeal to feline hearing. Again, individual cats vary. Some love it, others are indifferent. Olfactory enrichment engages your cat's powerful sense of smell. Catnip is the obvious one. About 70% of cats respond to catnip with excitement and playfulness. The other 30% have no reaction. It's genetic. If your cat responds, provide fresh catnip or catnip toys regularly, but not constantly, or they habituate and the response diminishes. Silvervine is an alternative that some cats prefer. It's a plant from Asia that causes similar euphoric reactions to catnip, but works on some cats who don't respond to catnip. Honeysuckle wood and valerian root are other scent-based enrichment options some cats enjoy. You can buy toys infused with these scents or loose dried herbs. Even bringing in new scents from outside can be enriching. Collect leaves, grass, or safe plants and let your cat sniff and explore them. The novel smells provide mental stimulation. Tactile enrichment involves different textures. Provide soft surfaces like fleece blankets, rough surfaces like sisal, smooth surfaces like wood or plastic, and crinkly textures like paper or certain cat toys. Variety keeps things interesting. Now let's talk about feeding enrichment. which is one of the most underutilized forms of enrichment and one of the most effective. In the wild, cats spend hours hunting. They stalk, pounce, catch, eat, rest, then repeat. The entire cycle provides physical exercise, mental stimulation, and satisfaction of instinctual drives. Indoor cats who eat from a bowl get the eating part but none of the hunting. Their food appears magically twice a day, and they consume it in 2 minutes. Then what? Nothing. For the rest of the day, that powerful hunting drive has no outlet. Food puzzles and feeding enrichment fix this. Instead of giving your cat their food in a bowl, make them work for it in ways that mimic hunting. There are hundreds of commercial food puzzles available, from simple to complex. Balls that dispense kibble as they roll. Puzzle boards with compartments the cat has to paw at to access food. Feeders that require the cat to fish out kibble through holes. You can also make DIY food puzzles. Put kibble in a toilet paper tube, fold the ends closed, and poke holes in it. Your cat has to bat it around to get the food out. Put wet food in an ice cube tray, freeze it, and give your cat a frozen cube to lick. Hide small portions of food around the house so your cat has to hunt for their meals. The benefits are massive. Food puzzles slow down eating, which helps prevent vomiting and obesity. They provide mental stimulation and problem-solving challenges. They satisfy hunting instincts. They extend the time cats spend engaged in food-related behavior from 2 minutes to potentially hours. And they make meals exciting and rewarding instead of mundane. Start simple if your cat isn't used to food puzzles. Don't make it so difficult they get frustrated and give up. Gradually increase difficulty as your cat gets the hang of it. Some cats take to puzzles immediately. Others need time to figure out that working for food can be fun. Social enrichment is interaction with people and, in some cases, other pets. Cats are not purely solitary. They're flexible social animals who can thrive alone or in groups, depending on their personality and experiences. Most cats benefit from regular positive interaction with their humans. This means dedicated playtime, ideally at least 2 sessions per day, 15 to 20 minutes each. Use interactive toys like feather wands, laser pointers followed by a physical toy they can catch, or toys on strings. The goal is to let your cat engage in predatory play, stalking, pouncing, and catching. Rotate toys to keep them interesting. If the same toys are out all the time, they become boring. Bring out different toys for different play sessions. Put some away for a few weeks, then reintroduce them as if they're new. Some cats also enjoy training sessions as social enrichment. We talked about training earlier. Teaching tricks isn't just about the tricks, it's about the interaction, the mental challenge, and the bonding time. Grooming, when done properly, can be social enrichment. Many cats enjoy being brushed, and it's quality time together. But don't force it if your cat hates grooming. It becomes stress, not enrichment. For some cats, having another cat as a companion provides social enrichment. They play together, groom each other, and keep each other company. But as we discussed in the multi-cat section, this only works if the cats actually like each other and the introduction is done properly. A cat forced to live with a cat they don't get along with experiences stress, not enrichment. Cognitive enrichment challenges your cat's brain with problem-solving, learning, and novelty. Food puzzles provide some of this, but you can go further. Teach your cat new tricks regularly. Even simple things like teaching them to target a new object or navigate a small obstacle course. Rotate your cat's environment periodically. Move furniture slightly. Rearrange their cat tree platforms. Introduce new hiding spots. Change where you place their toys. Novelty stimulates the brain and prevents habituation, where everything becomes so familiar it's boring. Create scavenger hunts. Hide treats or favorite toys around the house and let your cat search for them. This engages their hunting instincts and problem-solving skills. Some cats enjoy puzzle toys designed for cognitive challenge, toys where they have to manipulate parts to access treats, interactive electronic toys that move unpredictably. Even simple toys like ping-pong balls in a bathtub can provide hours of entertainment as your cat tries to catch something that keeps rolling away. Now let's talk about outdoor access for indoor cats, because this is possible without letting your cat roam freely. Catios, enclosed outdoor spaces specifically designed for cats, provide outdoor enrichment while keeping your cat safe. These can be as simple as a window box-style enclosure, or as elaborate as a large screened porch or enclosed run. Catios give your cat access to fresh air, natural sunlight, outdoor sounds and smells, and visual enrichment from watching birds and insects, all while protected from predators, cars, and disease. If you own your home and have the space and budget, a catio is one of the best investments you can make for your indoor cat's quality of life. For renters or people without outdoor space, window boxes mounted securely to a window can provide a mini catio experience. Your cat can sit partially outdoors in a screened box, experiencing the outside world safely. Leash training is another option, though not all cats tolerate it. Some cats can be trained to walk on a harness and leash, allowing supervised outdoor time in a controlled way. This requires patience, proper equipment, and training, but for cats who enjoy it, it provides incredible enrichment. Let's talk about specific enrichment ideas, over 50 of them, so you have concrete options to implement. For vertical space, wall-mounted cat shelves, tall cat trees, access to tops of cabinets or bookcases, stacked boxes creating climbing structures, ramps or stairs to high spaces. For hiding and security, cardboard boxes with entry holes cut, cat tunnels, covered beds or igloos, furniture arranged to create caves, closets or cabinets left slightly open for cat access. For scratching, multiple posts in different locations, horizontal scratching pads, angled scratching ramps, corrugated cardboard scratchers, sisal rope posts, tree branches secured for scratching. For visual enrichment, window perches at multiple windows, bird feeders outside windows, fish tanks, cat TV videos, view of a fish pond or fountain, access to screened porch or catio. For auditory, music designed for cats, nature sounds, white noise, audiobooks or podcasts playing, sounds of birds or wildlife. For scent, catnip toys rotated, silver vine, honeysuckle wood, valerian root, safe herbs like catgrass, outdoor scents brought inside on leaves or branches. For feeding enrichment, food puzzle toys at various difficulty levels, DIY puzzles from household items, scatter feeding where kibble is hidden around the house, snuffle mats where food is hidden in fabric, frozen treats, meals split into multiple small portions throughout the day. For play, feather wands, laser pointers, motorized toys, battery-operated mice, balls of various textures and sizes, toys with bells or crinkle sounds, toys infused with catnip, DIY toys from bottle caps or paper balls. For cognitive challenges, clicker training sessions, teaching new tricks, obstacle courses, treat dispensing puzzle toys, rotate toys weekly, introduce new objects periodically. For social, dedicated play sessions twice daily, grooming if cat enjoys it, talking to your cat throughout the day, appropriate interaction with other pets if they get along. Here's an enrichment schedule that works well for many cats. Morning, food puzzle for breakfast, 5-minute play session. Midday, access to window perch or catio, background enrichment like cat TV or music. Afternoon, scatter feeding or scavenger hunt for snacks. Evening, 15-minute interactive play session. Food puzzle for dinner. Nighttime, access to various enrichment options for self-directed activity. This doesn't mean you're actively engaging with your cat every moment. Much of this is environmental enrichment your cat accesses on their own, but the structure ensures your cat has stimulating activities throughout the day. Let's talk about common enrichment mistakes. The biggest one is providing enrichment once and thinking you're done. Cats habituate. That toy that was exciting last week is boring now. That food puzzle they mastered is no longer challenging. Enrichment has to be dynamic, changing, and ongoing. Another mistake is not matching enrichment to your individual cat. A high-energy young cat needs intense physical play and challenging puzzles. A senior cat with arthritis needs gentle enrichment, accessible from ground level. A shy cat needs enrichment they can engage with privately. A social cat needs interactive enrichment with you. Overstimulation is another issue. If you provide too much enrichment all at once, especially high-energy enrichment, some cats get overwhelmed and shut down. Start gradually, introduce new things one at a time, and watch your cat's response. Providing enrichment without supervision when it's needed is dangerous. Toys with strings or small parts can be ingested. Catnip can cause aggression in some cats. Monitor new enrichment until you're sure it's safe for your cat. Here's a success story. A cat named Oliver was overweight, lethargic, and had developed obsessive over-grooming to the point of creating bald patches. Medical issues were ruled out. The diagnosis was chronic boredom and under-enrichment. His owner implemented a comprehensive enrichment plan, food puzzles for all meals, daily play sessions with rotating toys, cat shelves installed creating vertical highways, a window-mounted Cadio box, scavenger hunts with treats hidden around the house, clicker training sessions teaching tricks. Within 2 months, Oliver had lost 2 pounds. The over-grooming stopped, and his fur grew back. He was active, engaged, playful. His personality changed from depressed and withdrawn to curious and interactive. The transformation came entirely from enrichment. Enrichment isn't optional. It's not spoiling your cat. It's meeting basic psychological needs. An enriched cat is a happy, healthy, well-adjusted cat. An under-enriched cat suffers, even if they don't show it, obviously. If you have an indoor cat and you're not providing comprehensive, ongoing enrichment, start today. You don't need to implement everything at once. Pick one category. Add food puzzles, or create vertical space, or commit to daily play. Then add another element. Build up over time. Your cat's quality of life will improve dramatically. You'll see it in their behavior, their health, their relationship with you. An enriched cat is a joy to live with. They're engaged, active, happy. They don't develop the behavioral problems born of boredom and frustration. They thrive instead of merely existing. Indoor life can be incredibly rich and fulfilling for cats, but only if we, as their caregivers, take responsibility for creating environments that meet their needs. They can't do it themselves. They depend on us. And when we get it right, the reward is a cat who lives a long, healthy, genuinely happy life. Section 12. Advanced Health Diagnostics. Let's talk about something most cat owners find intimidating: understanding diagnostic testing and lab results. Your vet runs blood work or takes x-rays, comes back with results, and tells you what they mean. But you're sitting there looking at numbers and images you don't understand, nodding along but secretly confused. And that's a problem, because you can't make truly informed decisions about your cat's care if you don't understand the diagnostic information. We're going to demystify the most common diagnostic tests, how to read blood work, what those numbers actually mean, what abnormalities indicate, and what the limitations are. Understanding urinalysis and what it reveals about kidney and bladder health. How to interpret x-rays and ultrasounds, what vets are looking for, and what different findings mean. When you should seek a second opinion, and how to know if you're getting quality diagnostics. And practical home health monitoring techniques so you can catch problems early. Let's start with blood work, because this is probably the most common diagnostic test your cat will have. There are 2 main types: the complete blood count, or CBC, which looks at blood cells, and the chemistry panel, which evaluates organ function and metabolic parameters. The CBC examines red blood cells, white blood cells, and platelets. Red blood cells carry oxygen throughout the body. The key values are red blood cell count, hemoglobin, and hematocrit. These numbers tell you whether your cat is anemic, meaning they don't have enough red blood cells to carry adequate oxygen. Anemia has many causes. Chronic kidney disease reduces red blood cell production. Blood loss from injury, parasites, or internal bleeding depletes red blood cells. Immune-mediated hemolytic anemia, where the immune system destroys red blood cells, is another cause. Certain infections and cancers can cause anemia. The blood work tells you anemia exists, but additional testing determines why. On the opposite end, polycythemia means too many red blood cells. This is less common but can occur with dehydration, certain heart or lung diseases, or rarely, bone marrow disorders. White blood cells fight infection and inflammation. The total white blood cell count, or WBC, goes up when there's infection, inflammation, stress, or certain cancers. It goes down with viral infections, bone marrow problems, or overwhelming infection that exhausts the immune system. But total WBC doesn't tell the whole story. You need the differential, which breaks white blood cells into types: neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Each type has specific functions, and their levels provide clues about what's happening. Elevated neutrophils, called neutrophilia, usually indicates bacterial infection, inflammation, or stress. Decreased neutrophils, neutropenia, can mean viral infection, bone marrow disease, or certain medications suppressing production. Elevated lymphocytes can indicate chronic infection, immune system stimulation, or certain cancers like lymphoma. Decreased lymphocytes might occur with stress, certain viral infections, or immunosuppression. Elevated eosinophils often suggest parasites, allergies, or inflammatory bowel disease. Elevated monocytes can indicate chronic inflammation or infection. Platelets are responsible for blood clotting. Low platelet counts, thrombocytopenia, can cause bleeding problems. Causes include immune-mediated destruction, bone marrow disease, certain infections, or consumption of platelets during clotting disorders. High platelet counts are less common but can occur with certain inflammatory conditions or cancers. Now, the chemistry panel, which evaluates organ function. Let's start with kidney values, blood urea nitrogen, or BUN, and creatinine. Both are waste products filtered by the kidneys. When kidneys aren't working properly, these values rise. But here's the critical thing most people don't know. By the time creatinine is elevated on blood work, your cat has already lost about 75% of kidney function. The kidneys have enormous reserve capacity. Early kidney disease doesn't show up on standard blood work. This is why newer tests like SDMA, symmetric dimethylarginine, are valuable. SDMA rises earlier in kidney disease, when only about 40% of function is lost. It's a more sensitive marker. BUN can be elevated for reasons other than kidney disease. Dehydration raises BUN. A high-protein meal before the blood draw can increase it. Gastrointestinal bleeding raises BUN because blood in the digestive tract is digested as protein. So BUN alone doesn't diagnose kidney disease. You need to look at the whole picture, including creatinine, SDMA, urinalysis, and clinical signs. Phosphorus is another kidney-related value. Kidneys regulate phosphorus levels, so when kidneys fail, phosphorus rises. High phosphorus contributes to further kidney damage and makes cats feel sick. Managing phosphorus through diet and binders is crucial in kidney disease management. Liver values include ALT, AST, ALP, and GGT. These are enzymes that leak from liver cells when they're damaged. Elevated liver enzymes indicate liver cell injury or dysfunction, but don't tell you the cause. It could be infection, inflammation, toxins, cancer, or a host of other conditions. Further testing like ultrasound or liver biopsy may be needed to determine what's actually wrong with the liver. Bilirubin is another liver-related value. It's a breakdown product of red blood cells. The liver processes bilirubin and excretes it in bile. Elevated bilirubin causes jaundice, that yellowing of skin and eyes. It can indicate liver disease, bile duct obstruction, or excessive red blood cell breakdown. Total protein and albumin reflect nutritional status, liver function since the liver makes most blood proteins, and kidney function since protein can be lost through damaged kidneys. Low protein can indicate malnutrition, liver disease, kidney disease, or protein-losing intestinal disease. High protein usually means dehydration or inflammation. Globulins are the other major blood proteins. Elevated globulins can indicate chronic infection, inflammation, or certain cancers like multiple myeloma. Glucose is blood sugar. High glucose hyperglycemia most commonly indicates diabetes, but can also occur with stress, especially in cats. Stress hyperglycemia can make it difficult to diagnose diabetes because some cats spike their blood sugar at the vet from fear. This is why fructosamine testing, which reflects average blood sugar over a couple of weeks, can be helpful. It's not affected by short-term stress. Low blood sugar hypoglycemia is less common but can occur with insulin overdose in diabetic cats, insulinoma, which is a rare tumor, severe infection, or liver failure. Electrolytes include sodium, potassium, and chloride. These regulate fluid balance, nerve function, and muscle contraction. Abnormalities can indicate kidney disease, certain hormonal disorders like Addison's disease, which is rare in cats, vomiting or diarrhea causing electrolyte loss, or certain medications. Potassium is particularly important in cats. Low potassium hypokalemia is common in cats with kidney disease or chronic vomiting. It causes weakness, muscle pain, and poor appetite. Supplementation is often necessary. High potassium hyperkalemia can occur in kidney failure, urethral obstruction where the cat can't urinate, or Addison's disease. It's dangerous because it affects heart rhythm and can cause cardiac arrest if severe. Now let's talk about thyroid testing, because hyperthyroidism is one of the most common hormonal disorders in older cats. Total T4 is the screening test. Elevated T4 indicates hyperthyroidism. But here's the complication. Some cats with hyperthyroidism have T4 levels that fluctuate in and out of the normal range. A single normal T4 doesn't rule out hyperthyroidism if clinical signs are present. Free T4 and other thyroid tests may be needed. Some cats have T4 levels at the high end of normal, but show all the classic signs of hyperthyroidism: weight loss despite increased appetite, hyperactivity, vomiting, increased thirst. These cats might have early hyperthyroidism that hasn't fully progressed. Rechecking T4 in a few weeks or months often shows it's clearly elevated by then. Urinalysis is the other major routine diagnostic test. It evaluates kidney function, looks for infection, checks for crystals or stones, detects blood or protein in urine, and can identify diabetes or other metabolic conditions. Specific gravity measures how concentrated the urine is. Healthy kidneys concentrate urine when the body needs to conserve water and dilute it when there's excess water. Urine-specific gravity in cats should be above 1.035 for concentrated urine. Dilute urine, with specific gravity below 1.030, suggests the kidneys aren't concentrating properly, which can indicate kidney disease, diabetes, hyperthyroidism, or other conditions. But context matters. A cat who just drank a lot of water might have dilute urine temporarily. A dehydrated cat should have very concentrated urine. If they don't, it's a red flag for kidney problems. pH tells you whether urine is acidic or alkaline. Normal cat urine is slightly acidic. Alkaline urine can promote certain types of crystals or stones and might indicate infection with bacteria that produce urease. Protein in urine, proteinuria, can indicate kidney disease, urinary tract inflammation or infection, or high blood pressure damaging kidneys. Small amounts of protein can be normal, but significant proteinuria needs investigation. Blood in urine, hematuria, can be visible to the naked eye or microscopic. Causes include urinary tract infection, bladder stones, trauma, or cancer. The urinalysis can detect microscopic blood even when urine looks normal. Glucose in urine, glucosuria, usually indicates diabetes. When blood sugar is high enough, it spills into urine. But glucosuria can occasionally occur from stress in cats, similar to stress hyperglycemia. Ketones in urine indicate diabetic ketoacidosis, a life-threatening complication of diabetes, or prolonged fasting where the body burns fat for energy. Crystals in urine can indicate risk for stone formation. Struvite crystals are common and can form stones if urine pH is alkaline and the cat has a urinary tract infection. Calcium oxalate crystals can also form stones. Diet and urine pH affect crystal formation. White blood cells and bacteria in urine indicate infection. But here's an important point. Bacteria can contaminate urine samples collected by free catch, where you collect urine as the cat pees. The most accurate method for diagnosing infection is cystocentesis, where a needle is inserted through the abdominal wall directly into the bladder to collect a sterile sample. If bacteria are present in a cystocentesis sample, it's a true infection. Now let's talk about imaging, X-rays and ultrasound. X-rays, also called radiographs, use radiation to create images of bones and organs. Dense structures like bones appear white, soft tissues appear gray, air and gas appear black. X-rays are excellent for evaluating bones, looking for fractures, arthritis, or bone tumors. They show the size and shape of organs. They can detect fluid in the chest or abdomen. They reveal foreign objects that are visible on X-rays, though not all foreign materials show up. Fabric, plastic, and some other materials are radiolucent, meaning X-rays pass through them and they're invisible on the image. Abdominal X-rays can show kidney size, which is important in kidney disease. Shrunken kidneys indicate chronic disease. They can reveal bladder stones. They show the outline of the liver, spleen, and intestines, though internal organ detail is limited without contrast studies. Chest X-rays evaluate the heart size and shape, looking for enlargement that might indicate heart disease. They detect fluid in the chest, masses or tumors in the lungs, and pneumonia or other lung disease. But X-rays have limitations. They're essentially shadows. They don't show organ internal structure well. Small soft tissue abnormalities can be missed. This is where ultrasound excels. Ultrasound uses sound waves to create real-time images of internal organs. It shows organ architecture, blood flow, and can distinguish between solid masses and fluid-filled structures. It's better than X-rays for evaluating abdominal organs like the liver, kidneys, pancreas, and intestines. Ultrasound can detect masses, cysts, abnormal organ texture, and fluid accumulations. It's the best imaging for evaluating heart structure and function, called echocardiography. It can guide biopsies or fluid sampling, allowing precise needle placement. But ultrasound also has limitations. It can't penetrate bone or air, so it's not useful for evaluating bones or gas-filled intestines. Image quality depends heavily on the skill of the person performing the scan. An inexperienced operator might miss abnormalities. Advanced imaging includes CT scans and MRI, which provide incredible detail but require general anesthesia and are expensive. These are usually reserved for complex cases where standard imaging doesn't provide enough information. Now let's talk about when to seek second opinions. You should consider a second opinion when you receive a diagnosis of a serious illness, especially cancer. Different specialists might offer different treatment approaches. When your cat isn't responding to treatment as expected, a second set of eyes might identify something missed. When a diagnosis is unclear or you're getting vague answers. When treatment costs are very high and you want confirmation before committing financially. When you simply don't feel confident in the diagnosis or proposed treatment plan. There's no shame in seeking second opinions. Good vets understand this and won't be offended. Your cat's health is too important to proceed with significant treatment based solely on one opinion if you have doubts. How to get useful second opinions. Request copies of all medical records, test results, and images to bring to the second vet. See a specialist rather than another general practitioner for complex conditions. Board-certified specialists have advanced training in their area. Be honest with the second vet that you're seeking a second opinion. Don't hide information or pretend it's a first visit. Give the second vet the same information you gave the first, so their opinion is based on complete data. Home health monitoring can catch problems early before they become emergencies. Weigh your cat regularly. Unexplained weight loss, even just half a pound in a cat, can indicate illness. Sudden weight gain might indicate fluid accumulation or metabolic changes. Monitor appetite and thirst. Increased thirst and urination are classic signs of kidney disease, diabetes, and hyperthyroidism. Decreased appetite is a nonspecific sign that something is wrong. Watch litter box habits. Changes in frequency, amount, straining, or accidents outside the box can indicate urinary or digestive problems. Check gum color periodically. Healthy gums are pink. Pale gums indicate anemia. Yellow gums suggest liver disease or jaundice. Blue or gray gums indicate lack of oxygen, an emergency. Feel for lumps or bumps during petting. Finding masses early improves treatment outcomes, especially with cancer. Monitor breathing rate when your cat is resting. Healthy cats breathe about 20 to 30 times per minute at rest. Consistent rates above 40 can indicate heart or lung disease. Keep a health journal. Write down any changes in behavior, appetite, water intake, litter box use, weight, or anything unusual. Patterns become obvious when you track things over time. You can bring this information to vet visits. Here's the key principle about diagnostics. They're tools, not absolutes. No test is 100% accurate. False positives and false negatives occur. Test results must always be interpreted in context with clinical signs, physical exam findings, and medical history. A normal blood work panel doesn't mean your cat is healthy if they're showing symptoms. It might mean the problem isn't detectable with blood work or it's too early in the disease process. Conversely, minor abnormalities on blood work might not be clinically significant if your cat feels fine and has no symptoms. This is why you need a vet who explains not just what the numbers are, but what they mean for your specific cat, who considers the whole picture, not just lab values in isolation, who communicates clearly and welcomes questions. Understanding diagnostics empowers you to participate actively in your cat's healthcare. You can ask informed questions. You can understand why certain tests are recommended and what they're looking for. You can make better decisions about treatment options when you understand the diagnostic information underlying those decisions. Don't be afraid to ask your vet to explain results in detail. Ask what normal ranges are and where your cat's values fall. Ask what could cause the abnormalities found. Ask about next diagnostic steps if results are unclear. A good vet will appreciate your engagement and take the time to educate you. Your cat can't speak for themselves. You're their advocate. The more you understand about diagnostics and health monitoring, the better equipped you are to ensure they get the care they need. Knowledge is power, especially when it comes to your cat's health. Section 13. Feline Cardiology Basics. Let's talk about something that often goes undetected until it's advanced: heart disease in cats. Unlike dogs, where heart disease often causes obvious symptoms like coughing and exercise intolerance, cats with heart disease can appear completely normal until they're in crisis. They don't cough from heart failure. They hide their symptoms. And by the time you realize something is wrong, the disease is often severe. We're going to cover the basics of how a cat's heart works, the most common types of heart disease in cats, how heart disease is diagnosed, what HCM screening involves, and which cats need it, treatment options, and what they actually do, quality of life considerations, and prevention strategies where they exist. Let's start with basic heart anatomy and function. The heart is a muscular pump divided into 4 chambers, 2 atria at the top and 2 ventricles at the bottom. The right side of the heart receives oxygen-poor blood from the body and pumps it to the lungs. The left side receives oxygen-rich blood from the lungs and pumps it out to the body. Valves between the chambers prevent blood from flowing backward. The heart muscle contracts rhythmically, pushing blood through the circulatory system. The heart rate in cats normally ranges from about 140 to 200 beats per minute, much faster than humans. When heart disease develops, the heart can't pump efficiently. This leads to a backup of blood, fluid accumulation in the lungs or abdomen, reduced oxygen delivery to tissues, and potentially blood clot formation. The most common heart disease in cats is hypertrophic cardiomyopathy, or HCM. This is a condition where the walls of the left ventricle become abnormally thick. The thickened muscle is stiff and doesn't relax properly. The chamber becomes smaller, so less blood fills it, and when it contracts, it doesn't pump as efficiently as it should. HCM has a genetic component in certain breeds, particularly Maine Coons, Ragdolls, British Shorthairs, Sphynx, and Persians. Genetic mutations have been identified in Maine Coons and Ragdolls, and testing is available for breeding cats to avoid producing affected kittens. But HCM also occurs in mixed breed cats with no family history. so genetics isn't the whole story. Symptoms of HCM when they occur include difficulty breathing or rapid breathing, especially if the cat is breathing with their mouth open, lethargy and reduced activity, though cats are good at hiding this, loss of appetite and weight loss in advanced cases, sudden paralysis of the hind legs due to a blood clot, called saddle thrombus, which is a devastating complication. But here's the problem. Many cats with HCM have no symptoms. They seem completely healthy. The disease is only detected during a routine exam when the vet hears a heart murmur, or during screening for other reasons, or when the cat suddenly develops congestive heart failure or throws a clot. Heart murmurs are abnormal sounds heard through a stethoscope caused by turbulent blood flow. But murmurs are tricky in cats. Some cats with significant heart disease have no murmur. Other cats have murmurs but no structural heart disease. A murmur might be innocent, meaning it's just the sound of blood flowing through a normal heart, or it might indicate disease. You can't tell from the murmur alone. This is why cardiac ultrasound, or echocardiography, is the gold standard for diagnosing HCM. An echo shows the heart walls, measures their thickness, evaluates how well the heart contracts and relaxes, looks at the valves and blood flow, and can detect structural abnormalities. An echocardiogram should be performed by a veterinary cardiologist or a vet with advanced training in cardiac ultrasound. The quality of the exam depends heavily on the skill of the person performing it. Poor technique can miss disease or misdiagnose normal cats. Which cats should be screened? All breeding cats of predisposed breeds should have echocardiograms to avoid breeding-affected individuals. Cats with heart murmurs should be evaluated to determine if the murmur indicates disease. Cats showing any respiratory symptoms or exercise intolerance should be checked. And some owners choose to screen senior cats even without symptoms, especially if they're of a predisposed breed, because early detection allows earlier intervention. If HCM is diagnosed, what are the treatment options? There's no cure. Treatment focuses on managing symptoms, slowing progression, and preventing complications. Medications include beta blockers like atenolol, which slow the heart rate and help the heart muscle relax. ACE inhibitors like enalapril or benazepril, which reduce blood pressure and workload on the heart. Calcium channel blockers like diltiazem, which also help the heart relax and reduce heart rate. If congestive heart failure develops, meaning fluid accumulates in or around the lungs, diuretics like furosemide are used to remove excess fluid. Cats in heart failure often need oxygen therapy and hospitalization initially. Anti-clotting medications like clopidogrel or aspirin are sometimes prescribed to reduce the risk of blood clot formation, especially in cats with significant heart disease or previous clotting events. Saddle thrombus is one of the most devastating complications of HCM. A blood clot forms in the heart, breaks loose, and travels through the bloodstream until it lodges where the aorta splits to supply the hind legs. The clot blocks blood flow to the legs, causing sudden paralysis, pain, and cold limbs. This is an emergency. The prognosis is guarded even with treatment. Some cats can be managed through the acute crisis and regain some function, but many don't survive or are euthanized due to poor quality of life. Prevention through anti-clotting medication in high-risk cats is the best approach. Other types of heart disease in cats include restrictive cardiomyopathy, where the heart muscle becomes stiff from scar tissue, dilated cardiomyopathy, where the heart chambers enlarge and the muscle weakens, used to be common but became rare after taurine was added to commercial cat foods. Taurine deficiency causes dilated cardiomyopathy. Hyperthyroidism can cause heart disease by making the heart work too hard over time. And congenital heart defects, present from birth, occur but are less common. Quality of life with heart disease depends on severity. Cats with mild HCM and no symptoms can live normal lives for years, possibly their entire lifespan. Cats with moderate disease may need medication but still have good quality of life. Cats with severe disease, especially once congestive heart failure develops, have a more limited prognosis, typically months to a couple of years, though some cats exceed expectations. Monitoring cats with heart disease involves regular recheck exams, periodic echocardiograms to track progression, chest x-rays if respiratory symptoms develop to check for fluid, and blood pressure monitoring since heart disease and high blood pressure often occur together. At home, watch for changes in breathing rate or effort. If your cat's resting respiratory rate increases consistently above 40 breaths per minute, contact your vet. This can indicate fluid buildup. Watch for reduced activity, though this is subtle in cats. Loss of appetite or weight loss. Any difficulty breathing or open-mouth breathing is an emergency. Prevention of heart disease is limited because much of it is genetic or idiopathic, meaning we don't know the cause. But you can reduce risk factors. Feed a diet with adequate taurine, which commercial cat foods provide. Prevent and treat hyperthyroidism, which can contribute to heart disease. Manage high blood pressure if it develops. And for breeders, screen breeding cats and don't breed affected individuals to reduce genetic transmission. Heart disease in cats is serious, but it's not automatically a death sentence. With proper diagnosis, appropriate treatment, and monitoring, many cats with heart disease live comfortably for years. The key is early detection and proactive management before complications develop. If your cat is diagnosed with heart disease, work closely with your vet or a cardiologist. Understand the specific type of disease, the severity, the treatment plan, and what to watch for at home. Keep up with medications and rechecks, and know that while heart disease is a significant diagnosis, it doesn't mean your cat can't still have good quality of life. Section 14, Kidney Disease, Complete Management. Let's talk about one of the most common and most serious chronic diseases in cats, kidney disease. Also called chronic kidney disease, or CKD, this condition affects an estimated 30 to 40% of cats over the age of 10, and the percentage increases with age. It's progressive, incurable, and eventually fatal. But here's what most people don't know. With proper management, cats with kidney disease can live for months or even years with good quality of life. We're going to cover everything you need to know about kidney disease. How kidneys work and what happens when they fail, the stages of kidney disease and what each stage means, how kidney disease is diagnosed and monitored, subcutaneous fluid therapy and how to do it at home, diet for kidney disease and why it matters, medications and supplements that help, managing complications like high blood pressure and anemia, quality of life assessment, and how to make difficult decisions when the time comes. First, let's understand what kidneys do. Kidneys are remarkable organs that perform multiple critical functions. They filter waste products from the blood and excrete them in urine. They regulate fluid balance, controlling how much water the body retains or eliminates. They maintain electrolyte balance, particularly sodium, potassium, and phosphorus. They regulate blood pressure through hormone systems. They produce erythropoietin, a hormone that stimulates red blood cell production. And they activate vitamin D, which is necessary for calcium absorption and bone health. When kidneys fail, all of these functions are compromised. Waste products accumulate in the blood, causing nausea, loss of appetite, and lethargy. Fluid and electrolyte imbalances develop. Blood pressure often rises. Anemia develops as erythropoietin production decreases. Calcium and phosphorus metabolism becomes abnormal, contributing to further kidney damage and other problems. Chronic kidney disease develops when the kidney tissue is damaged and loses function gradually over time. The damage is permanent. Kidney tissue doesn't regenerate. But kidneys have enormous reserve capacity. A cat can lose up to 75% of kidney function before showing obvious symptoms. This is why kidney disease is often advanced by the time it's diagnosed. Causes of CKD include age-related degeneration, where kidneys simply wear out over time. Polycystic kidney disease, which we discussed in the genetics section, is a genetic cause common in Persians. Chronic bacterial infections can damage kidneys. Immune-mediated diseases where the immune system attacks kidney tissue. High blood pressure damages the delicate filtering structures. Toxins, including certain medications and antifreeze, can cause acute kidney damage that progresses to chronic disease. And many cases are idiopathic, meaning we don't know the cause. Kidney disease is staged from 1 to 4 based on blood creatinine levels and SDMA. Stage 1 is the earliest, where kidney disease is present but creatinine and SDMA are still normal or only mildly elevated. Diagnosis at this stage usually requires finding protein in the urine or structural abnormalities on imaging. Stage 1. Cats often have no symptoms. Stage 2 is mild kidney disease. Creatinine is mildly elevated, typically between 1.6 and 2.8 milligrams per deciliter. SDMA is between 18 and 25. Cats might have no symptoms or very mild symptoms, like slightly increased thirst and urination. Stage 3 is moderate kidney disease. Creatinine is between 2.9 and 5 milligrams per deciliter. SDMA is between 26 and 38. Cats at this stage typically have noticeable symptoms: increased thirst and urination, decreased appetite, weight loss, occasional vomiting, and decreased energy. Stage 4 is advanced kidney disease. Creatinine is above 5. SDMA is above 38. Cats are obviously ill. They have severe symptoms including poor appetite or complete refusal to eat, frequent vomiting, extreme lethargy, dehydration, and may develop complications like severe anemia or very high blood pressure. The stage tells you disease severity and helps guide treatment intensity, but it doesn't predict exactly how long a cat will live. Some stage 2 cats progress slowly and live for years. Others decline rapidly. Some stage 3 cats stabilize with treatment and do well for extended periods. Prognosis depends on many factors beyond just the stage. Diagnosis starts with blood work showing elevated creatinine, BUN, SDMA, and often phosphorus. Urinalysis shows dilute urine. The kidneys unable to concentrate properly. Sometimes protein is present in the urine, called proteinuria, which indicates kidney damage and is a negative prognostic factor. High blood pressure is common and needs to be checked. Ultrasound can show kidney size and structure. Small, irregular kidneys indicate chronic disease. Large kidneys might suggest acute disease, infection, or polycystic kidney disease. Once diagnosed, cats need regular monitoring. Blood work every few months to track kidney function and electrolytes. Blood pressure checks at every visit. Urinalysis to monitor protein levels and check for infection. Weight monitoring to ensure the cat maintains body condition. Now let's talk about treatment, starting with one of the most important interventions, subcutaneous fluid therapy. Cats with kidney disease often become chronically dehydrated because damaged kidneys lose too much fluid. Dehydration makes them feel terrible, worsens kidney function, and creates a downward spiral. Subcutaneous fluids, or sub-Q fluids, are sterile fluids given under the skin, usually at home by the owner. The fluid is absorbed over several hours, providing hydration without the stress and expense of daily vet visits for intravenous fluids. Here's how it works. You'll need bags of sterile saline or a balanced electrolyte solution like lactated ringers, a fluid administration set with tubing and a needle, and a way to hang the bag above the cat. Your vet will prescribe the specific fluid type and amount based on your cat's needs, typically 50 to 150 milliliters per session, given daily or several times a week. The technique involves hanging the fluid bag, attaching the tubing, filling the tubing to remove air bubbles, and then inserting the needle under the skin between the cat's shoulder blades, where there's loose skin. You create a tent of skin, insert the needle into the space under the skin, and open the flow control to let fluid run in. The fluid creates a bulge under the skin, like a camel hump, which is normal. It absorbs over the next few hours. It sounds intimidating, but most owners become comfortable with it quickly. The needles are small and most cats tolerate it well, especially when they start feeling better from the hydration. Some cats even come running for fluids because they associate it with feeling good. Diet is the other cornerstone of kidney disease management. Prescription kidney diets are formulated with restricted protein, restricted phosphorus, increased omega-3 fatty acids, and sometimes additional potassium. The goal is to reduce the workload on the kidneys and minimize accumulation of waste products while maintaining adequate nutrition. Protein restriction is somewhat controversial. Too much protein creates more waste that damaged kidneys must process, but too little protein leads to muscle wasting and malnutrition. Prescription kidney diets strike a balance, using high-quality protein in moderate amounts. Phosphorus restriction is critical. High phosphorus directly contributes to further kidney damage and makes cats feel sick. Kidney diets are low in phosphorus. If blood phosphorus remains high despite diet, phosphate binders are added. These are supplements given with food that bind phosphorus in the digestive tract, preventing its absorption. Many cats are reluctant to eat kidney diets, especially if they feel nauseated from the kidney disease. This creates a dilemma. The diet helps, but only if the cat eats it. If your cat refuses the prescription diet, don't starve them trying to force it. Work with your vet to find a food your cat will eat. Sometimes a regular food that's relatively low in phosphorus and combined with phosphate binders is better than a cat who won't eat the prescription food at all. Appetite stimulants like mirtazapine or meropitant can help cats who are nauseous or have poor appetite. Mirtazapine is a transdermal gel applied to the inside of the ear, making it easy to give. It stimulates appetite and has anti-nausea effects. Meropitant is an anti-nausea medication that can be given as pills or injections. Medications for kidney disease include ACE inhibitors, like benazepril or enalapril. These lower blood pressure, reduce protein loss in urine, and may slow disease progression. Not all kidney disease cats need them, but they're commonly prescribed, especially if blood pressure is high or significant proteinuria is present. If blood pressure is high and doesn't respond to ACE inhibitors alone, amlodipine, a calcium channel blocker, is added. High blood pressure damages kidneys further and can cause blindness from retinal detachment, so controlling it is critical. Potassium supplementation is often needed. Many cats with kidney disease lose too much potassium in urine, leading to hypokalemia. Low potassium causes weakness, poor appetite, and muscle pain. Oral potassium supplements or potassium-enriched diets correct this. Erythropoietin injections treat anemia in cats whose kidneys no longer produce enough of this hormone naturally. Synthetic erythropoietin stimulates red blood cell production. It requires regular injections and monitoring, but it can dramatically improve quality of life in anemic cats. Omega-3 fatty acid supplements, particularly from fish oil, have anti-inflammatory properties and may slow kidney disease progression. Many kidney diets include them, but additional supplementation is sometimes recommended. Managing complications is part of kidney disease care. Urinary tract infections are more common in cats with kidney disease. Dilute urine doesn't flush bacteria as effectively. Watch for signs of infection, straining to urinate, blood in urine, or accidents outside the litter box. Regular urinalysis can detect infections before they cause symptoms. Nausea and vomiting are common as waste products accumulate. Anti-nausea medications, acid reducers like famotidine or omeprazole to reduce stomach acid, and appetite stimulants all help manage this. Constipation can occur, especially in cats who are dehydrated or receiving phosphate binders. Stool softeners, increased water intake through fluids, and sometimes laxatives address this. Quality of life is what ultimately matters. A cat in early-stage kidney disease with good appetite, normal energy, and minimal symptoms has excellent quality of life. A cat in advanced disease who's eating well with medication support, has decent energy, and enjoys interaction can still have good quality of life. But a cat who won't eat despite medication, vomits frequently, is extremely lethargic, and shows no interest in life has poor quality of life. This is when you need to have honest conversations with your vet about whether continued treatment is extending life in a meaningful way or prolonging suffering. Quality of life. Assessment tools can help. They score various factors: pain, hunger, hydration, happiness, mobility, and more good days than bad. Be honest in your assessment. It's easy to rationalize or make excuses because you don't want to let go, but your cat deserves to have their suffering acknowledged and addressed, even when that means making the hardest decision. Some cats with kidney disease reach a point where they stop responding to treatment. Fluids no longer help. They won't eat. they're clearly suffering. At that point, euthanasia is the kindest option. It's not giving up. It's recognizing that the disease has progressed beyond what medicine can manage and choosing to prevent further suffering. Other cats stabilize and do well for extended periods. I've known cats diagnosed in stage 2 who lived 3, 4, even 5 more years with good quality of life. Stage 3 cats who stabilized and lived happily for a year or 2. Even some stage 4 cats who responded well to aggressive treatment and bought themselves months of good time. The key is early detection, consistent treatment, regular monitoring, and honest assessment of quality of life. Kidney disease is manageable for a time. It's not immediately terminal. With the right care, cats can live well despite failing kidneys. If your cat is diagnosed with kidney disease, don't panic. Educate yourself. Work with your vet to create a treatment plan. Learn to give subcutaneous fluids if recommended. Find a diet your cat will eat. Keep up with medications. Monitor at home for changes. And communicate with your vet about how your cat is doing. Kidney disease is a journey. There will be good days and bad days. There will be adjustments to medications and treatment plans. There might be crises that require hospitalization, but there will also likely be periods of stability where your cat feels good and enjoys life. Cherish the good time you have. Take it day by day, and when the time comes that treatment is no longer helping, be brave enough to let go with love. Kidney disease will eventually win. But with proper management, you can give your cat months or years of quality life before that happens, and that's worth fighting for. So there you have it. We've covered an enormous amount of ground in this first half of the Advanced Masterclass. We've gone deep into cat psychology and cognition, understanding just how intelligent and emotionally complex your cat truly is. We walked through complete kitten development from birth to 1 year, giving you the knowledge to raise the most well-adjusted cat possible. We broke down advanced training techniques that prove cats are absolutely trainable when you use the right approach. We explored feline genetics and what responsible breeding actually looks like. We dove into advanced nutrition, including raw feeding and homemade diets for those who want more control over what their cat eats. We went deep on dental care, because your cat's teeth matter more than most people realize. We solved litter box problems with systematic troubleshooting that actually works. We tackled anxiety and stress management, giving anxious cats the tools and support they need to feel safe. We mastered multi-cat household dynamics, because living with multiple cats successfully requires real skill and understanding. We learned to read advanced body language, turning you into someone who can truly understand what your cat is communicating. We created comprehensive enrichment plans that transform indoor cats from bored to thriving. And we got into the medical side, understanding diagnostics, interpreting lab results, learning about heart disease, and diving deep into kidney disease management. These are topics that will likely touch your life as a cat owner at some point, and now you have the knowledge to navigate them confidently. But we're not done. Not even close. In the second half of this advanced masterclass, we're going deeper into chronic disease management, diabetes, hyperthyroidism, and cancer care. We're covering disabled cat care for cats with special needs. We're exploring feral cat socialization for those who rescue and rehabilitate. We're mastering medication administration so you can confidently give pills, liquids, and injections at home. We'll walk through post-surgery care, international moving with cats, and the detailed, compassionate approach to end-of-life care that every cat owner needs to understand. We'll cover cat-proofing for specific dangers, advanced grooming techniques, and even cat shows and competitions for those interested in that world. And we'll wrap up by looking at the future of cat care, the emerging research and technology that's changing how we understand and care for cats. This is advanced knowledge. This is the kind of information that separates casual cat owners from true cat experts. And you're well on your way. Take a break if you need one. Process what you've learned. Maybe revisit sections that are particularly relevant to your cat. But when you're ready, come back for the second half. Because we're going to take everything you've learned so far and build on it even further. Your cat is lucky to have someone who cares enough to invest this kind of time in understanding them. That commitment matters. It translates directly into better care, earlier problem detection, and ultimately, a longer, healthier, happier life for your feline companion. So I'll see you in the next part, where we continue this journey into advanced cat care mastery. Until then, take care of yourself and your cats. And remember, every moment you spend learning about cats is an investment in the relationship you share with them. See you soon.